Today, the Health Subcommittee held its first subcommittee markup for the 118th Congress. The American people delivered a strong message to Congress in November of last year and elected Republicans to lead the House. Americans wanted safer streets, secure borders, and a government that is accountable to them. We have already delivered on a few of those promises by voting to end the COVID-19 public health emergency and voting to end the Centers for Medicare and Medicaid Services COVID-19 vaccine mandate on our healthcare heroes, to name just a couple of bills. Today, we're one step closer to delivering on more promises that will protect our children, secure our borders, and uphold the dignity of human life. The legislation before us today will help ensure Americans live longer, healthier lives and will bring us one step closer to ensuring parents can sleep easier at night, knowing that we're cracking down on illicit fentanyl and fentanyl-related substances that are threatening the lives of tens of thousands of Americans. Over the past 2 years, we have seen historic rises in illicit fentanyl seizures at our southern border and, sadly, record high fentanyl poisonings and drug overdoses. Too many Americans have lost their lives due to drug overdose, largely driven by synthetic opioids like illicit fentanyl. In my home state of Kentucky, illicit fentanyl contributed to over 70% of all overdose deaths in the Commonwealth in 2021, which saw an increase of 14% in drug overdoses between 2020 and 2021. That's why it's important for me to support the Halt Fentanyl Act that is before us today. This bill was introduced by my colleagues, Representative Griffith and Latta, and would permanently schedule fentanyl-related substances as Schedule I drugs. It is long past due for this legislation to become law and finally remove the incentive for criminals to create new fentanyl-related substances. We can't keep kicking the can down the road. We should have a permanent solution to address the flow of fentanyl-related substances coming into our communities. Further lack of permanent action only emboldens those trafficking these toxins into our communities and allows criminals to continue tearing our communities apart. The Halt Fentanyl Act isn't the only solution to address the unprecedented supply of drugs flooding our streets. Ms. Lesko's legislation, the Securing the Border for Public Health Act, would expand current Title II 42 authority to allow the Secretary of Health and Human Services, after consultation with the Attorney General, to stop persons and property from entry into the United States to prevent the flow of certain controlled substances and protect our nation's public health. This bill will help prevent dangerous illicit drugs are not being trafficked into our communities. To be clear, votes for these bills are not votes to reform our nation's immigration laws. These are votes to strengthen our public health security and continue our work to combat the overdose crisis and save lives. We must also take steps to ensure we're working to stem the tide of this crisis through legal channels and ensure there isn't an oversupply of prescription opioids on our streets. That is why I strongly support Representative Harshbarger's legislation, H.R. 501, Block Report Suspend Suspicious Shipments Act, which will require drug manufacturers and distributors to report all suspicious orders of controlled substances to the DEA and require these entities to decline to fill such orders. Fighting the overdose epidemic necessitates a multi-pronged approach and a strong partnership between the public and private sectors, which this legislation accomplishes. The next piece of legislation before us today, 498, the 988 Lifeline Cybersecurity Responsibility Act, will address cybersecurity vulnerabilities within the 988 Suicide and Crisis Lifeline system to help ensure individuals in emotional distress or suicide crisis continue to have access to this life-saving resource without disruption. I thank Representative Obernolte for leading this important bill and urge its immediate passage. Last is Chair Rogers' H.R. 485, the Protecting Healthcare for All Patients Act of 2023, which would permanently ban the use of quality-adjusted life years in all federal health programs. These discriminatory measures pick winners and losers by valuing some lives more than others and reduce access to potentially life-saving treatments for vulnerable populations. Like those living with disabilities, I urge the swift passage of this important legislation. Thank you, and I yield back. And the chair now recognizes my good friend from California, Ms. Eshoo, for 5 minutes for an opening statement.
Thank you, Mr. Chairman, and good afternoon, colleagues. During the health hearing on 4 of these bills that we're taking up today, I stated my view that the bills could win bipartisan support if we negotiated the specifics. I said to the chairwoman that day, let's get this figured out. Since then, our Republican colleagues have come to the table to negotiate, and we're extremely close on a bipartisan agreement to ban the use of the discriminatory metric named quality-adjusted life years. As the chairman just said, this cost-effectiveness metric inherently devalues the lives of people with a disability. I'm committed to getting to an agreement before the committee, the full committee marks up the bill, and I thank the chairwoman for her work with us on this to make it so. Unfortunately, there hasn't been an effort to negotiate how to permanently schedule illicit fentanyl-related substances in the Halt Fentanyl Act. This is unfortunate because I think we could also get to a bipartisan bill if the Republicans would come to the table. Most Democrats support permanently scheduling illicit fentanyl-related substances. We just need to make sure the policy on mandatory minimums is revised to avoid continuing the ineffective and harmful policies of the past. Mandatory minimums should take into account whether the cases involve overdoses or serious bodily harm. Democrats will offer bipartisan, I think common sense amendments to the Halt Fentanyl Act to strengthen the Republican effort, and I urge subcommittee members to vote for these bipartisan amendments. I'm disappointed that we're marking up the Securing the Border for Public Health Act to authorize the HHS Secretary to suspend all immigration and imports from a given foreign country to prevent the distribution of controlled substances. This is an inflammatory and far-reaching immigration bill that has never been heard by a subcommittee. I can't support it, and I think that we can do much better than this. Finally, we're marking up two bipartisan bills. Thankfully, the Block Reporting and Suspend Suspicious Shipments Act. That requires drug manufacturers, distributors, and other DEA registrants to report and decline to fill suspicious orders of controlled substances. The 988 Lifeline Cybersecurity Responsibility Act is a common sense bill that requires the 988 network administrator to report potential cybersecurity threats to SAMHSA immediately. And that's something I think we all can and will support. This subcommittee should continue our tradition of bipartisan work to improve our nation's health care. I look forward to a productive markup and advancing bills that can pass the Senate and be signed into law by the President. With that, I yield back, Mr. Chairman.
Thank the gentlelady for yielding back, and the chair now recognizes the chair of the full committee, Chair McMorris Rogers, for 5 minutes for an opening statement.
Thank you, Mr. Chairman, and thank you to all my colleagues who are leading on bills today. Together, we are taking action to address the illicit fentanyl crisis, protect the 988 Suicide and Crisis Lifeline, and stop discrimination against people with disabilities. More people than ever are dying from fentanyl poisonings. As many parents have appealed to us, this requires urgent action. Moms like Molly Kane deserve justice. We must secure the border and do everything in our power to make sure law enforcement has the tools that they need to seize fentanyl and fentanyl-related substances. That's why we're advancing Representative Griffith and Latta's Halt Fentanyl Act and Representative Lesko and Miller-Meek's bill, the Securing the Border for Public Health Act. The Halt Fentanyl Act would permanently place fentanyl-related substances into Schedule I of the Controlled Substances Act and make sure law enforcement can keep these weapons-grade poisons off our streets. DEA testified just last month that permanently scheduling fentanyl-related substances in Schedule I is their #1 legislative priority. And in our field hearing in McAllen, we all heard and saw why. The Securing the Border for Public Health Act would expand current Title 42 authority to be used to stop the import of certain controlled substances, including fentanyl and fentanyl-related substances. I want to be very clear. The Biden administration cannot let the emergency scheduling order expire, and it should not lift Title 42. If the administration continues its open border agenda, Mexican cartels, like the one that just kidnapped 4 Americans and killed 2 of them, will be even more emboldened. I urge us to come together to save lives, halt fentanyl, stop the criminals pushing these poisons, and secure our border. I also want to recognize Rep. Harshberger's Block, Report, and Suspend Suspicious Shipments Act. The opioid epidemic was fueled in part by suspiciously large shipments of controlled substances being delivered across the country, especially in the Appalachian region. This bill would help stop this practice and save lives by requiring drug manufacturers and distributors that discover a suspicious order for controlled substances to halt the order and report that information to DEA. Additionally, the 988 Suicide and Crisis Lifeline suffered a cyber attack and was shut down for several hours late last year. This lifeline is a critical tool that provides support and hope to people in suicidal crisis or emotional distress. We don't yet know the magnitude of the individuals impacted by the outage, but we must make sure it doesn't happen again. Thank you, Rep. Obernolte, for your work on the 988 Lifeline Cybersecurity Responsibility Act. It requires coordination and reporting to improve cybersecurity protections for the 988 Suicide and Crisis Lifeline. Lastly, regarding my legislation to ban the use of quality-adjusted life years, or QALYs, and other similar measures by state and federal government healthcare programs, more than 70 disability and patient organizations agree that QALYs are discriminatory and have no place in our decision-making. Imagine having to beg the government for a drug for your son with a progressive disease. Imagine being told by the government his life isn't worth the cost of his medication. Or being told that your child with Down syndrome has a life less worthy of saving, and therefore the government won't cover the cost of an organ transplant. The federal government can evaluate the effectiveness of treatments and cures without devaluing the lives of seniors and people with disabilities. I'll have an amendment to reflect feedback from HHS and other stakeholders to ensure that this legislation achieves its goal, and I hope that it will be recommended with broad support to the full committee. At the center of all these bills today, the Energy and Commerce Committee is leading to affirm that every life is worth living. For those in despair, we are offering hope for a brighter and more secure future for all. And it is critical that we continue to make progress on these bills in today's subcommittee. I look forward to our discussion and the work to come for the People's House to take action on these solutions. Thank you, and I yield back.
I thank the gentlelady for her opening statement, and the chair now recognizes the ranking member of the full committee, the gentleman from New Jersey, Representative Pallone, for 5 minutes for an opening statement.
Thank you, Chairman. Today, the subcommittee is marking up 5 bills, some bipartisan and others partisan. It's unfortunate that the Republicans have decided to include the partisan Halt Fentanyl Act as part of this markup. Every member of this subcommittee agrees that we must continue to work to address the overdose crisis that is devastating communities across the nation. Last Congress, we were able to work together to achieve bipartisan policy reforms to address the substance use crisis and to increase access to prevention, treatment, and recovery services. This bipartisan work was critically important because more than 107,000 Americans died from an overdose over a 12-month period in 2022, and 60% of overdose deaths that year involved synthetic opioids like fentanyl. This complex public health problem requires thoughtful, measured solutions. And that's why I am disappointed that my Republican colleagues have not tried to work with us in a bipartisan manner on this issue so far this Congress, and instead of bringing a partisan bill that I believe stands no chance of becoming law. Republicans have also included H.R. 801, a misguided expansion of Title 42 authorities that does not address the root causes of the opioid crisis. It is a bill that represents a massive expansion of executive power, allowing the Secretary of Health and Human Services the ability to restrict the rights of those seeking legal asylum protections based on an undefined threat. Under our reading of the bill, the legislation would also allow the Secretary to shut down all legal ports of entry and block international trade indefinitely under the sole finding of a serious danger of certain controlled substances entering the country. And I don't think that ever was the intent of the public health provisions under Title 42. I fear this legislation is a political stunt, and rather than considering evidence-based, balanced public health approaches to the fentanyl crisis, Republicans are focusing on pushing partisan immigration policy. We're also considering H.R. 485, a bill to ban the use of quality-adjusted life years in federal health programs in states. While I'll work to find a bipartisan path forward before a full committee markup, I continue to be concerned about the scope of the underlying bill. Specifically, I have asked for changes to ensure that the bill will not impact the implementation of the prescription drug negotiation provisions included in the Inflation Reduction Act. In particular, we need to make clear that this proposed prohibition on the use of quality-adjusted life years in federal law does not bar the use of non-discriminatory measures of a drug's value. Unfortunately, we were unable to come to an agreement on my requested language change in time for the subcommittee markup. And while the language has come a long way since the legislative hearing, it still needs work in order to gain my support. I also hope Republicans will be willing to work with our colleagues on the Armed Services Committee, the Veterans Affairs Committee, and other affected committees to understand the impact of these changes on programs within their jurisdiction. I don't think that work has begun yet, and I look forward to continuing to work with the majority to ensure the language accomplishes our shared goals. I'm also committed to continue to work between now and the full committee on comprehensive strategies that combat illicit fentanyl, support our border, and ensure that all Americans can access the treatment that they need. Now, we're also considering two bills today that have bipartisan support. One, H.R. 501, the Block Report and Suspend Suspicious Shipments Act, and H.R. 498, the 988 Lifeline Cybersecurity Responsibility Act. And I thank the members who worked on these bills and look forward to advancing them to the full committee. And with that, Mr. Chairman, I yield back.
I thank the gentleman for yielding back. The chair reminds members that pursuant to the committee rules, all members' opening statements will be made part of the record. Are there any further opening statements? Seeing none, the chair calls up H.R. 501 and asks the clerk to report.
H.R. 501, a bill to amend the Controlled Substances Act to require registrants to decline to fill certain suspicious orders and for other purposes.
Without objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point. So ordered. Does anyone seek to be recognized on the bill?
Mr. Chairman,
For what purpose does the gentlelady from Tennessee seek recognition?
I move to strike the last word in support of the bill.
The gentlelady is recognized for 5 minutes to strike the last word.
Thank you, Mr. Chairman. I want to thank Chairman Guthrie and Chairwoman McMorris Rogers for convening this meeting on these health bills, and also to thank my colleague, Representative Debbie Dingell, for joining me in introducing H.R. 501, the Block Report and Suspend Suspicious Shipments Act. I know she's worked hard to advance this legislation in the past couple of Congresses. Breaking the opioid epidemic stronghold on our nation is one of my foremost priorities, and in an effort to do so, my colleagues and I have introduced legislation that requires drug manufacturers, distributors, and other drug enforcement administration registrants to report and to halt suspicious orders of controlled substances with the requirements and guardrails needed to ensure these addictive and potentially dangerous drugs do not fall into the wrong hands while the DEA investigates. Future generations depend on us solving the addiction crisis, and this is an important step towards that outcome. I look forward to advancing this bipartisan legislation and to continuing to work with the committee and stakeholders to ensure that this bill is as effective and workable as possible. As we move toward hopeful enactment of H.R. 501 and continue our fight against opioid substance use disorders, I hope this committee and Congress will work with the DEA to ensure that the system for reporting suspicious orders is operated in a common sense and balanced way, and that the agency does not unreasonably impair access to therapies that have been proven effective in combating the opioid overdose crisis. And with that, I yield back.
The gentlelady yields back. The gentlelady from Michigan is recognized. For what purpose does the gentlelady from Michigan seek recognition?
I move to strike the last word.
The gentlelady is recognized for 5 minutes to strike the last word.
Thank you, Mr. Chairman. I rise in strong support of H.R. 501, the Block Report and Suspend Suspicious Shipments Act. As most of you know, the opioid crisis is a very serious concern of mine, as it is to everyone on this committee. Too many families have lost a loved one due to a drug overdose, including my own. My home state has been hit hard. In Michigan, 8 individuals die of a drug overdose every day, and this is just simply unacceptable. Pill dumping and other dodgy practices have perpetuated the opioid crisis, which continues to upend communities across the nation. That's why I've been so proud to again introduce the Block Report and Suspend Suspicious Shipments Act, which advanced through this committee and passed on the House floor the past 2 Congresses. Hope springs eternal. Maybe we'll really help people. But I'm really happy to have a partner and to lead this reintroduction on this legislation with Rep. Harshbarger, who is going to be a great partner, and I so appreciate her work. And I look forward to working with Chairwoman Rogers and Ranking Member Pallone to make additional changes to strengthen the bill. When it comes to identifying ways to keep Americans safe, we must look at the roles and responsibilities of drug manufacturers and distributors. With this legislation, we can require drug manufacturers, distributors, and other DEA registrants to not only report, but also block or decline to fill suspicious orders. I would like to thank Chairman Guthrie and Ranking Member Eshoo for including this bill as part of today's markup and advancing this bipartisan effort to address the abusive practices which are fueling the ongoing opioid crisis. I urge all of my colleagues to support this important legislation. Thank you, Mr. Chair, and I yield back.
Thanks. I thank the gentlelady. The gentlelady yields back. Anyone seeking recognition? The chair recognizes the chair of the full committee, Ms. Morris-Rogers, for 5 minutes.
Move to strike the last
Strike the
word.
last word. Chair recognizes McMorris-Rogers.
Thank you, Mr. Chairman. H.R. 501, the Block Report and Suspend Suspicious Shipments Act, is bipartisan legislation. It's critical in helping combat the opioid epidemic. The legislation requires DEA registrants to practice due diligence when discovering suspicious orders of controlled substances. The registrants shall then decline to fill and report the order to DEA. We've received relevant stakeholder feedback, and I would just wanted to ask the ranking member for his commitment that as we move forward to the full committee, we work together to address stakeholder and agency recommendations to ensure everyone's voice is heard. And I yield to the ranking member.
Thank you, Madam Chairwoman. H.R. 501, the Block Report and Suspend Suspicious Shipments, is a bipartisan bill that has passed through regular order in this subcommittee in both the 116th and 117th Congresses. And this bill clarifies that drug distributors must perform due diligence when discovering a suspicious order of controlled substances. Further, it clarifies that if distributors cannot dispel the factors that led to the original suspicion, they must decline to fill the order, record the appropriate information, and report it to the DEA. I understand that the sponsors of the bill and our staffs have worked in a bipartisan manner to reintroduce this bill and make updates. It's been brought to my attention that this bill may need additional changes, but we're waiting for supplementary feedback from stakeholders and federal agencies. So you have my commitment to working with you and the sponsors to make any necessary changes between now and a future full committee markup, and I'm confident that we share the goal of creating good policy, and so for that I yield back. Thank you, Madam Chair.
Thank you. I yield back.
The gentlelady yields back. Does anyone seek to be recognized on the bill? Seeing no one seeking recognition, are there bipartisan amendments to the bill? Seeing no amendments, are there other amendments to the bill? No amendments being offered. The question now occurs on forwarding of H.R. 501 H.R. 501 to the committee. All those, excuse me, let me say it again. The question now occurs on forwarding 501 to the full committee. All those in favor say aye.
Aye.
All opposed say no. A roll call vote being requested. You have roll call vote being requested. So the roll call, the request for the ayes and nays, so the clerk shall call the roll.
Guthrie.
Aye.
Guthrie votes aye. Burgess. Burgess votes aye. Latta. Latta votes aye. Griffith. Bilirakis. Bilirakis votes aye. Johnson. Johnson votes aye. Bouchon.
Aye.
Bouchon votes aye. Hudson.
Aye.
Hudson votes aye. Carter. Carter votes aye. Dunn. Dunn votes aye. Pence. Pence votes aye. Crenshaw. Crenshaw votes aye. Joyce. Joyce votes aye. Harshbarger. Harshbarger votes aye. Miller Meeks. Miller Meeks votes aye. Obernolte. Obernolte votes aye. Rogers. Rogers votes aye. Eshu. Eshu votes aye. Sarbanes. Cardenas. Ruiz. Dingell. Dingell votes aye. Custer. Custer votes aye. Kelly. Kelly votes aye. Barragan. Barragan votes aye. Blunt Rochester. Blunt Rochester votes aye. Craig.
Aye.
Craig votes aye. Schreier. Trahan. Trahan votes aye. Pallone. Pallone votes aye.
How is Mr. Griffith recorded?
Mr. Griffith is not recorded. Griffith votes aye. Cardenas is not recorded. Cardenas votes aye.
Anyone else is seeking to answer the roll? Seeing none, the clerk shall report. Louise, how's Louise recorded?
Ruiz is not recorded. Ruiz votes aye.
The clerk shall report.
Chair Guthrie, on that vote, there were 28 ayes and 0 nays.
With 28 ayes and 0 nays, the ayes have it. The bill is agreed to. The chair calls up HR 498 and asks the clerk to report.
HR 498, a bill to amend Title V of the Public Health Service Act to secure the suicide prevention lifeline from cybersecurity incidents and for other purposes.
Without objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point so ordered. Does anyone seek to be recognized on the bill? The gentleman from California, do you seek recognition?
Mr. Chair, I have an amendment at the desk.
The gentleman is recognized. Clerk shall report the amendment.
Amendment in the nature of a substitute to HR 498, offered by Mr. Obernolte. Strike all after the enacting clause and insert the following. Section 1, short title. This act may be cited as the 988 Lifeline Cybersecurity Responsibility Act. Section 2, protecting suicide prevention.
The reading can be dispensed with without objection. So Mr. Obernolte is recognized.
Thank you, Mr. Chair. I'm proud to be the author of HR 498, the 988 Lifeline Cybersecurity Responsibility Act. I'm sure that everyone in this room is aware of the critical role that the 988 Lifeline plays in preventing suicide in the United States. It's been a critical resource for many Americans who've been in crisis and has prevented, I'm sure, countless deaths. Unfortunately, in December, the 988 hotline was taken down due to a cyber attack on the system's operator. This bill is a response to that incident. It would improve cybersecurity awareness and reporting, as well as making other necessary changes to ensure that an incident like this does not occur again. The amendment in the nature of a substitute that I'm offering incorporates stakeholder feedback that will make the bill more easily to implement and clarify some of its provisions. I'd also like to thank my bipartisan co-sponsor, Tony Cardenas of California, for his tireless work on this issue, and I respectfully urge adoption of the amendment and your support of the bill. I yield back.
The gentleman yields back. Is there any discussion on the amendment? For what purpose is the gentleman from California seek
To
recognition?
strike the last word, Mr.
The
Chair.
gentleman is recognized for 5 minutes.
Thank you very much. I'm enjoying working with my colleague, Obernolte, on this very important issue, and I really appreciate your leadership and glad to be working on a bipartisan basis on behalf of all the people of our great country. So with that, I just want to point out a few things, that it's impossible to ignore the worsening state of mental health across our country. And treating this as an issue separate from health overall is a grave error, would be a grave error. Mental illness and substance use disorders are involved in 1 out of every 8 emergency department visits by a U.S. adult, and suicide is the second leading cause of death among people ages 10 to 14. It is clear that we need to treat this as the legitimate health crisis that it is. This is one of the reasons why I believe there's so much promise in the 988 Suicide and Crisis Lifeline. Not only does the 3-digit calling code provide a 24/7 lifeline to individuals in crisis from anywhere in the United States, it also represents a change in the way we think and respond to mental health illness as something that warrants help and support, just like other kinds of health conditions. 988 in its fullest form is not just a number, but a connection to full mental health crisis response. In other words, 988 provides someone to call, someone to come, and somewhere to go. I'm thrilled that the Lifeline is rapidly increasing its capacity to provide life-saving care, due in part to the Biden administration, which has made implementation of 988 a priority nationally. It is paying off, and it's saving American lives every day. But the Lifeline's promise can only be realized if it remains secure. That's why I'm proud to partner again with my colleague, Representative Obernolte, to co-lead the 988 Lifeline Cybersecurity Responsibility Act, which would help to protect 988 from future interference. After the Lifeline experienced a service interruption in December due to a suspected cyber attack, it became clear that we must do more to defend the Lifeline and ensure that it can continue to provide essential services to those in need at every moment. This bill aims to prevent this from happening again by creating certain requirements to improve coordination and reporting on cybersecurity incidents and vulnerabilities. 988 is revolutionizing the way we address mental health in this country, in our country. It is critical that we preserve the Lifeline's ability to provide these life-saving services. This is a common sense proposal that will safeguard ongoing 988 operations. And once again, I appreciate this opportunity for us to work on a bipartisan basis on behalf of all of the American people, especially the American people who are in need in a mental health crisis moment. And with that, Mr. Chairman, I yield back.
The gentleman yields back. The chair would make the subcommittee aware that there is a vote on the floor. Is there any other discussion of the amendment? Seeing no one seeking recognition, if there's no further discussion, the vote occurs on the amendment. All those in favor shall signify by saying aye. Aye. All opposed, nay. The ayes have it, and the amendment is agreed to. Is there any discussion on the bill? So to it, right. So I'm looking for the vote. Do you have it? Oh, here we go. The question now occurs on forwarding H.R. 498 to the full committee as amended. Excuse me, let me say again. The question now occurs on forwarding H.R. 498 as amended to the full committee. All those in favor say aye. Aye. All opposed, no. Is there a roll call vote request? A roll call having been requested, the clerk shall call the roll.
Guthrie.
Aye.
Guthrie votes aye. Burgess. Burgess votes aye. Latta. Latta votes aye. Griffith. Griffith votes aye. Bilirakis. Bilirakis votes aye. Johnson. Bouchon. Bouchon votes aye. Hudson. Hudson votes aye. Carter. Carter votes aye. Dunn. Dunn votes aye. Pence. Pence votes aye. Crenshaw. Crenshaw votes aye. Joyce. Joyce votes aye. Harshbarger. Harshbarger votes aye. Miller Meeks. Miller Meeks votes aye. Obernolte. Obernolte votes aye. Rogers. Rogers votes aye. Eshu. Eshu votes aye. Sarbanes. Cardenas. Cardenas votes aye. Ruiz. Ruiz votes aye. Dingell. Dingell votes aye. Custer. Custer votes aye. Kelly. Kelly votes aye. Barragan. Barragan votes aye. Blunt Rochester. Blunt Rochester votes aye. Craig. Craig votes aye. Schreier. Trahan. Trahan votes aye. Pallone. Pallone votes aye.
Is there anyone seeking to be recognized to enter the roll? Anyone seeking to enter the roll? Seeing none, the clerk shall report.
Chair Guthrie, on that vote, we have 27 ayes and 0 nays.
With 27 ayes and 0 nays, the bill as amended will be reported to the full committee. Now the chair will make the subcommittee aware we have a vote on the floor. We will recess and return right after the final vote on the floor, and we have 3 bills before us to move forward on. Thank you. The committee is in recess. Calls up H.R. 485 and asks the clerk to report.
H.R. 485, a bill to amend Title 11 of the Social Security Act to prohibit the use of quality-adjusted life years and similar measures in coverage and payment determinations under federal health care programs. Be enacted.
Without objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point. So ordered. Does anyone seek to be recognized on the bill? For what purpose does the gentlelady seek recognition?
I have an, strike the last word.
The gentlelady's recognized for 5 minutes.
Thank you, Mr. Chairman. I have an amendment at the desk.
The clerk shall report.
It's
Report the
a,
amendment.
it's a substitute amendment.
Amendment in the nature of a substitute to H.R. 485, offered by Ms. Rogers. Strike all after the enacting clause and insert the following.
Without objection, the reading of the amendment is dispensed with, and the gentlelady is recognized for 5 minutes in support of her amendment.
Thank you, Mr. Chairman. Preventing discrimination against people with disabilities should be a nonpartisan issue, and I'm grateful that we're taking action today to ban the use of quality-adjusted life years, or QALYs, and other discriminatory coverage practices that devalue the needs of people with disabilities in federal health programs like Medicare and Medicaid. QALYs represent a methodology that can be utilized by a healthcare payer, whether it's Medicare or Medicaid or any other insurer, to put a value on the life of a patient in order to decide how much their life is worth and if a certain treatment is cost-effective to help that person. In short, QALYs put a government bureaucracy in charge to determine if your life is worth living. Measurements like QALYs remove the consideration of unique circumstances and health conditions of a patient and their doctor's judgment from deciding what's best for the patient. Instead, QALYs aggregate the quality and quantity of individual lives without regards to the relative value that a treatment or intervention may bring. What's worse is that QALYs discriminate against people with disabilities and the elderly by discounting the value of a patient's life just because of the disabilities they may live with after a course of treatment, or that they might not be projected to live as long as others after treatment. Every life has value and meaning, and we should not be letting the federal government and health insurers continue to devalue people like this. Some have asked why we need the bill, since QALYs can sound merely theoretical. They rely on mathematical equations and are hard to imagine in the abstract. So here's what this bill will do. Today, if you have a disease like Duchenne's muscular dystrophy, your Medicaid plan can decide on your behalf or your doctor's behalf that the progression of the disease is too advanced to be worth paying for treatments. So maybe just because your child is in a wheelchair, they may not get the treatment that could extend their life. That's unacceptable. We heard testimony from Ms. Candy Pickard from the National Down Syndrome Society that these measures devalue the lives of people with disabilities. Candy, a mom whose son Mason has Down syndrome, emphasized that QALYs ultimately, in a real and not merely abstract sense, restrict access and coverage to necessary healthcare treatments because certain lives just aren't deemed worthy of the cost of treatment. And to those concerned that this gives a blank check to the healthcare industry, that is not the case. There are other measures of cost effectiveness that don't discriminate against those with disabilities. This substitute amendment maintains the goal and the intent of the introduced bill, but reflects comments from HHS to make implementation clearer and ensure that federal agencies like the Center for Medicare and Medicaid Innovation are held accountable and cannot waive this important protection. I'm hopeful that we can get bipartisan support for this legislation today, and I urge everyone on the committee to vote yes on this amendment and on the underlying bill. I yield back.
The gentlelady yields back. Anyone seeking recognition, discussion of the amendment? The gentlelady from California is recognized for 5 minutes. What purpose does the gentlelady from California seek recognition?
To strike the last word, Mr. Chairman.
Gentlelady is recognized for 5 minutes.
Thank you. And to speak on Chairwoman Rogers' amendment to H.R. 485. Colleagues, at the heart of this bill and the amendment is the use of quality-adjusted life years, which is a cost-effectiveness metric that inherently devalues the lives of people with a disability. For more than 20 years, disability rights advocates have opposed the use of quality-adjusted life years, or QALYs. To address this concern, Democrats included a ban on QALYs in Medicare in the Affordable Care Act in 2010. Last year, Democrats further clarified that QALYs could not be used as part of Medicare's prescription drug price negotiations in the Inflation Reduction Act. I'm thrilled that we are extremely close to bipartisan agreement on a bill that extends the Affordable Care Act's ban on QALYs to also include Medicaid, the Children's Health Insurance Program, and Medicare's demonstration authority. I thank Chairwoman Rogers, Chairman Guthrie, and Ranking Member Pallone and their staffs for their hard work on this bill. It has been hard work, but it's worth it. There's a bit more work needed to fully vet and agree to this proposed language. I think we're nearly there, and I look forward to voting for a bipartisan amendment when the full committee convenes at our next markup. If we can get this done on a bipartisan basis, we'll have a bill that can pass the House, the Senate, and be signed into law by the President. And this will fulfill a 20-year goal of the disability community and take a clear stand against discrimination. So let's get this thing done. On a final note, I think it's especially poignant that we're making this important progress for disability rights on the day of Judy Heumann's funeral. She was New York City's first teacher in a wheelchair and spent decades, really all of her life, fighting discrimination against disabled people, and her legacy continues to today. I think she's watching from heaven and applauding very hard. So I thank you, Mr. Chairman, Chairwoman Rogers, and again, Ranking Member Pallone, for the hard work that's been put into this. It really is worth it. And with that, I yield back the balance of my time.
Thank you. The gentlelady yields back, and the chair recognizes himself for 5 minutes to strike the last word. I strongly support H.R. 485, the Protecting Healthcare for All Patients Act, introduced by the leader of the full committee, Chair Rogers. I know this legislation is especially important to Chair Rogers and the entire disability community, and for good reason. H.R. 435 would permanently ban the use of quality life adjusted, or QALYs, years and similar measures under the Federal Care Program. The Institute of Clinical and Economic Review, or ICER, defines QALYs as the academic standard for measuring how well all different kinds of medical treatments lengthen or improve patients' lives. ICER's website justifies the application of QALYs by specifically stating that failing to consider the cost of such treatments without knowing how effective they are dries up costs and reduces access to patients. To directly quote part of the website, it states, "True discrimination against people with disabilities continues in this country and happens every day when people can't afford or access the care they need." ICER and other aligned organizations may purport to care about access to care, but the reality is the application of such standards inherently means less access to care for thousands of Americans. In fact, these policies aren't meant to promote greater access to care. They are exclusively meant to contain healthcare spending at the expense of our most vulnerable populations. The National Council on Disability agrees. In 2019 report published by the independent government agency responsible for providing recommendations to policymakers on policies that would improve the quality of life for Americans, the agency states, nonetheless, in an effort to lower the healthcare costs, public and private health insurance providers have utilized the quality adjusted life year to determine the quality effectiveness of medications and treatment. NCD further states QALYs place a lower value on treatments which extend the lives of people with chronic illness and disabilities. In addition, quality-based programs have been found to violate the American with Disabilities Act. This legislation is about ensuring we are honoring the principles of basic human dignity. Individuals with disabilities, chronic conditions, and others to whom Qualities or similar measures may discriminate to serve the chance to choose which treatments they access without a Washington bureaucrat or an academic with no clinical experience making the decision for them. No one deserves to have a price put on their life. An individual with disabilities or with chronic conditions, life is worth living just as much as any other person, period. And to my colleagues that express concerns about the specific language of this bill, while being clear they do not support discrimination of any kind at last month's hearing, I believe we have found a solution to your concerns in the proposed amendment. If you care about supporting the needs of our most vulnerable, we will get this language in the next amendment and we'll support this bill. I urge my colleagues to support the legislation, and I yield back. Anyone seeking further recognition on the amendment? The gentleman from New Jersey is recognized. For what purpose is the gentleman from New Jersey recognition?
Move to strike the last word and speak on the Ains.
Gentleman is recognized.
Thank you, Mr. Chairman. I want to thank the Chairwoman Rogers for working with us to address many of the concerns we had about this bill. The text of the Ains is a substantial improvement over the underlying bill. While we're still working through the technical assistance from the Department of Health and Human Services, I'm hopeful that we'll be able to resolve any outstanding issues. We can all agree that it's wrong to treat one life as more or less valuable than another life, and that's why we made sure to include language in the Inflation Reduction Act that prohibits the Secretary from extending the life of a disabled, elderly, or chronically individual as less valuable than extending the life of a non-disabled, younger, or non-chronically ill individual. The Ains before us reiterates this protection and reinforces our commitment to these principles. However, based on technical feedback from the Department of Health and Human Services, I am concerned that the text of the Ains could still be read as being more broad than what the majority intends. It's important to clarify that the Ains is not intended to create a brand new requirement in Medicare, but rather to clarify the scope of the existing requirements. And this technical assistance from HHS hopefully provides some help, and I believe it's important to incorporate to ensure that this bill is not interpreted more broadly than the majority intends. I hope that before the full committee markup, we can make sure that these changes are adopted, and I want to thank the Chairwoman for her willingness to work with us on this bill. I understand her passion for this issue, and I look forward to continuing to work with her on expanding access to health care for individuals with disabilities. And with that, Mr. Chairman, I yield back.
The gentleman yields back. Anyone seeking recognition on the bill? The gentleman from Texas, what purpose do you seek recognition?
Move to strike the last word to speak on the
Gentleman is recognized for 5 minutes.
Thank you, Mr. Chairman. I am in support of the amendment and in support of the underlying bill, H.R. 485. Grateful to Chair Rogers for introducing this bill, Chairman Smith over on Ways and Means, my friend from Ohio, Dr. Wenstrup. This bill aims to preserve access to life-saving cures and prevent discrimination against Americans with disabilities. So I practiced medicine for over 30 years. During that time, I treated each patient as a human being, not just a diagnosis. The quality-adjusted life year measurements seem inherently cruel and inhibit a doctor's ability to care for and treat all patients with dignity. From the physician's perspective, I believe that the government should never have the ability to decide or determine the value of a life or approve or deny care. The political aspect and the history of the quality-adjusted life year concept is itself quite interesting. Oftentimes, these metrics are employed by countries that have a government-controlled healthcare system as a way to devalue treatment for those with chronic conditions or disabilities. This concept has been pushed by some socialist healthcare advocates for years. Dr. Ezekiel Emanuel was a key health figure in the Obama administration and often advocated for the use of quality-adjusted life year metrics. In a published Lancet article, Dr. Emanuel argues that a complete lives system could be used to access care in which adolescents and young adults receive priority. The article reflects the viewpoint that consideration of the importance of complete lives also supports modifying the youngest first principle by prioritizing adolescents and young adults over infants. He authored a piece in Atlantic several years ago with the title, "Why I Hope to Die at 75. His opinion demonstrates that value of life is a mindset characterized by the sense of value that comes from the productivity a person contributes, as well as physical or mental limitations. Here's the bottom line. It is not the government's place to determine that a life is worth living with a chronic condition or disability. This is why we need to prohibit the use of quality-adjusted life years in all federal programs and ensure that all human life has inherent value. And I thank the chair for bringing this amendment forward and look forward to supporting the amendment and the underlying bill. And I'll yield
Will the gentleman yield?
Yes, I'll be happy to yield.
It's Bouchon down here. Yeah, I just want to back up everything Dr. Burgess just said. As a provider, everyone is a human being and should be treated with respect and dignity. And I support the aims and the underlying bill strongly, and I suggest its passage. I yield back.
And I'll yield back.
Gentleman yields back. Is anyone seeking recognition? The gentlelady from Michigan, what purpose do you seek recognition?
Mr. Chairman, I move to strike the last word.
Gentlelady is recognized for 5 minutes.
Thank you, Mr. Chairman. And I want to thank you and the ranking member and the full committee chair and the ranking member of the full committee for all of the work on this, because it is a very serious issue for both the senior community and the disability community. Protecting Americans living with disabilities is something that's deeply important to me. I was honored when Jim Langevin asked me to take over as co-chair of the House Disability Caucus. And as you all know, I lived with John Dingell, who you all knew and loved the last 4 years, and witnessed too many things firsthand. We know QALYs are a discriminatory metric that unjustly devalues the lives of aging Americans and those living with disabilities. And that's why we did include language in the IRA to prohibit the use of these discriminatory metrics. But we must also ensure this bill meets its goals of prohibiting the use of QALYs while keeping drug costs low for all Americans. It's my hope we can all continue working together to review and incorporate the technical feedback from the Department of Health and Human Services to ensure this is done in the best way prior to a full committee markup. Americans living with disabilities deserve our full support, and I look forward to continuing our important work to uplift the lives of all. Thank you, Mr. Chair, and I'll yield back.
The gentlelady yields back. Anyone seeking recognition? The gentleman, Georgia, what purpose do you seek recognition?
Mr. Chairman, I move to strike last word.
Gentleman is recognized for 5 minutes.
Mr. Chairman, I'm glad to join my colleagues in supporting the Protecting Healthcare for All Patients Act. As my colleagues have pointed out, this legislation would permanently ban the use of quality-adjusted life years in all publicly funded healthcare programs like Medicare and Medicaid. Quality-adjusted life year measurements put a dollar value on a person's life, often devaluing the lives of those with chronic illnesses and disabilities. In countries with these measurements, people with chronic illnesses and disabilities like ALS, Down syndrome, get pushed to the back of the line for treatment. The government says their lives don't matter. They aren't valuable enough. Well, we're here today to say that all human life has inherent value and should be treated as such. As a pharmacist for 4 decades, I treated each patient that walked into my pharmacy as a human being, not just as a diagnosis or a dollar sign. I believe it is vitally important that our healthcare system values all lives and ensures that every person is treated with dignity. That's why it is long overdue for Congress to take the necessary step of banning quality-adjusted life year measurements. Patients should not be denied coverage because their path to care is more complicated than others. I urge all of my colleagues on this subcommittee to protect people with disabilities with the Protecting Healthcare for All Patients Act. Thank you, Mr. Chairman, and I yield back.
The gentleman yields back. Anyone seeking recognition for discussion of the amendment? If there is no further discussion, the vote occurs on the amendment in the nature of a substitute. All those in favor shall signify by saying aye. Aye. All opposed, nay. The ayes have it, and the amendment is agreed to. The question now occurs on forwarding H.R. 485 as amended to the full committee. All those in favor say aye. Aye. All opposed say no. The ayes have it, and the bill is agreed to. No recorded vote. No. Gentlelady, okay, no recorded vote. Okay, good, thank you. So next, The chair calls up H.R. 801 and asks the clerk to report.
H.R. 801, a bill to amend Title III of the Public Health Service Act to provide for suspension of entries and imports from designated countries to prevent the spread of communicable diseases and import into the United States of certain controlled substances. Be enacted by the Senate and House of Representatives of the United States of America and Congress assembled. Section 1, short title. This act may be cited.
Without objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point so ordered. Does anyone seek to be recognized on the bill? So what purpose does the lady from Iowa seek to be recognized?
Mr. Chairman, I move to strike the last word.
The gentlelady is recognized.
Thank you, Mr. Chairman. I speak in support of H.R. 801, and I thank you for recognizing me in bringing up this critical piece of legislation. While the COVID-19 pandemic is over, we are experiencing a deadly illicit drug crisis that pervades our nation, largely through our southern border. The CDC estimates that over 100,000 Americans died from drug overdoses between August 2021 and August 2022, 70,000 of which resulted from fentanyl or its analogs. The Biden administration admits that the fentanyl killing American enters our country primarily through the U.S.-Mexico border, but also ignores the border crisis and its impact on Americans all across the nation. If there is any doubt that the fentanyl or opioid crisis is an epidemic, let me say that the CDC has repeatedly called the fentanyl crisis an epidemic, citing the number of drug overdose deaths has more than quintupled in the last 24 years. This largely comprises vast increases in opioid and synthetic opioid-involved deaths, which has also been highlighted by news outlets such as the Washington Post, CNN, and Fox. The critical piece of legislation, which I'm proud to be leading with Congresswoman Lesko, expands Title 42 to allow for the immediate expulsion of illegal immigrants due to public health risks posed by the exorbitant amount of illicit drugs crossing the border. I look forward to the bill moving through committee, and I'll urge all my colleagues to vote yes. Thank you.
Will the gentlelady yield? Will the gentlelady yield?
Yes.
I thank the gentlelady for yielding. I strongly support H.R. 801, the Securing the Border for Public Health Act, which would expand Title 42 authority to help stop the flow of illicit drugs, such as fentanyl-related substances from entering the United States. Currently, Section 265 of U.S. Code 42 only applies to any communicable disease that would pose a danger to U.S. citizens. Under this authority, the Secretary can suspend entry of persons and property coming from designated countries in the interest of public health. Representative Lesko's bill would expand the authority to certain controlled substances such as narcotics, opiates, and fentanyl-related substances to ensure illicit drugs aren't flooding our streets and effectively turning every state into a border state. In October 2017, President Trump declared the opioid epidemic a public health emergency. Since that time, opioid overdoses have continued to climb significantly, reaching 107,000 deaths in 2021. 71,000 of these overdoses are due to synthetic opioids such as fentanyl. Simultaneously, we have also seen a record number of illegal border crossings and illicit drug seizures at our southern border, especially illicit fentanyl. In fiscal year 2021, Customs and Border Patrol seized over 10,000 pounds of illicit fentanyl at our southern border. That number jumped over 14,000 pounds in fiscal year 2022. In the first 4 months of this fiscal year, Customs and Border Patrol have already seized over 8,000 pounds. H.R. 801 is an important step toward preventing the increasing supply of illicit drugs in the U.S. and our communities and strengthening our overall public health security. To be clear, this isn't a silver bullet to ending drug overdose epidemic once and for all. We need to couple efforts such as with efforts to address both growing demand of these drugs and strengthen access to treatment and recovery support programs. I look forward to working with my colleagues on the committee to do just that through the reauthorization of the Support Act later this year. I urge my colleagues to support this bill. Now I'll yield back to the gentlelady from Iowa.
Thank you for your comments, Mr. Chair, and I think you're very appropriate in saying this is, number one, a crisis. It's been identified as a public health emergency. It's been identified as an epidemic. Words matter, and we know that this is also a multifaceted endeavor that we have to undertake, and this is only one small step into treating the record numbers of overdoses and drug addiction in this country. I yield back.
The gentlelady yields back. Anyone seeking recognition? What purpose does the gentleman from New Jersey seek recognition?
I strike the last word and speak on the bill.
Gentleman is recognized for 5 minutes.
Thank you, Mr. Chairman. I move to strike the last word. As I noted in my opening statement, this bill has not had a hearing in the Health Subcommittee, and committee Republicans decided to move this legislation straight to markup. And that's unfortunate, especially given the vast and detrimental implications of this policy. It would have been very beneficial to hear from public health officials and stakeholders on how this policy conflicts with the legal right to seek asylum in our country. A legislative hearing would have also allowed subcommittee members to better understand our law enforcement agency's role in protecting against the entry of controlled substances into the U.S., not our public health agencies. Right now, under Section 362 of the Public Health Service Act, the federal government may suspend the right to introduce persons or property into the U.S. if there's a serious danger of the introduction of a communicable disease into the nation. We know that these authorities have been utilized of both the Trump and Biden administrations to respond to COVID-19. However, this bill would expand the public health authority to prohibit the entry of people into the U.S., including those seeking legal asylum protections, should the Secretary of Health and Human Services determine there is a danger of the introduction of certain controlled substances into the nation. This policy completely rewrites the Title 42 authorities within our public health laws by massively expanding the ability for the federal government to deny the entry of persons or property into the U.S. in a way that circumvents the original intent of the law. This authority should not and cannot substitute for our nation's immigration policy or be used to unfairly and inhumanely block entry into the country. Unfortunately, it appears the intent of this bill is to do just that by vastly expanding the Secretary's authority. And this policy could easily be used to close our nation's borders to entrance of any country that an administration may not support based on an overbroad and vague determination that there is a serious danger of certain controlled substances entering the U.S. from that country. This would also mean as long as any drugs are being smuggled into the U.S. from anywhere, our borders could be shut down indefinitely. Now, how a secretary may make this determination is unclear to me and nearly unilateral. He or she would only be required to consult with the Attorney General before instituting this sweeping policy. It also appears that this bill would allow the Secretary to shut down legal ports of entry by denying property from entering the United States from countries he or she determines are a serious danger. Now, this could block entry of all kinds of goods into the United States, potentially crippling our trading capabilities, our international supply chain for goods. Americans rely upon it every day, and given that the Secretary these new authorities would not only dictate immigration policy, but also trade, a power that I think could be easily abused. So my Republican colleagues who often rely on the expansion of executive power have no problem with the vast expansion of executive authority represented by this bill. Apparently, when it serves their political goal, then the ideological consistency gets thrown to the side. So while I share the majority's interest and commitment to solving our nation's fentanyl crisis and better controlling the entry of illicit substances into the United States, the public health provisions under Title 42 were drafted to protect our country from the spread of communicable diseases, not to create partisan and misguided immigration policy under the guise of drug control. Our public health agencies are not immigration or drug control experts. They're public health experts. As HHS noted in the technical assistance they provided on this bill, and I quote, federal law enforcement agencies outside of HHS have in place mechanisms to detect and divert controlled substances entering the United States. HHS also noted that the committee should consider, and I quote, whether they would be better suited to implement the proposed authority. I have strong concerns, Mr. Chairman, with this bill, and I believe the policy is misguided. We should be working together to create a fair and just immigration system and ensuring that our law enforcement agencies have appropriate capabilities to detect and divert controlled substances. However, this is not the role of Health and Human Services, CDC, or other public health agencies. And for this reason, I oppose the bill, and I urge my colleagues to oppose it as well, and I yield back, Mr. Chairman.
The gentleman yields back. Anyone seeking recognition? Gentlelady from California is recognized.
Thank you, Mr. Chairman. I move to strike the last word on H.R. 801. Colleagues, I think that this bill is jaw-dropping because it vastly expands Title 42 authorities. In this Congress, the majority has prioritized votes to end the public health emergencies. And now we're voting to expand the CDC's emergency powers for reasons that have nothing to do with communicable disease. We've heard endless complaints from our Republican colleagues that public health agencies have too much power over our daily lives. Now, this bill gives the HHS secretary unchecked authority over drug enforcement, immigration, and trade decisions. That's what it does. I don't want the HHS secretary to have these powers. I think that this is just bad policy. The legislation attempts to flow the flow of fentanyl and its analogs by prohibiting immigration and trade from countries that illegally traffic drugs into the United States. However, more than 86% of those convicted of trafficking fentanyl are U.S. citizens driving cars and commercial vehicles through legal ports of entry. And high demand, and this is really shameful and horrible, attached to our country, that we have such high demand from U.S. citizens that drives the drug trade. If Americans didn't use illegal drugs, there wouldn't be a market to illegally distribute them. The massive expansion of executive authority under this legislation would do little to stop the movement of fentanyl across the border or decrease the demand for illicit substances. Yes, we're in the midst of the most devastating drug epidemic in U.S. history, but this bill doesn't present solutions. And for all the reasons that I've outlined in my comments, I don't think that that HO1 should be coming out of our subcommittee, going to the full committee, and I've stated my reasons for opposing it, and I hope other colleagues will as well. With that, Mr. Chairman, thank you, and I yield back.
The gentlelady yields back. Is anyone else seeking recognition on the bill? Seeing no one else. Mr. Cardenas, the gentleman from California, what purpose do you seek recognition?
To strike the last word, Mr. Chairman.
The gentleman is recognized for 5 minutes.
Thank you very much, Mr. Chairman. Before I give my remarks, I want to say how much I enjoy being on this committee, and at times find it a pleasure and a joy to work with my colleagues on both sides of the aisle. But at this moment, I'm just so upset. This bill before us, Securing the Border for Public Health Act of 2023, the title itself sounds very good, but the bill itself is very bad. And it's shameful that my colleagues across the aisle are using this hearing to bring up a bill that has not gone through regular order, a bill that blatantly attacks immigrant communities. Unfortunately, I'm not surprised. Why are you driven to use immigrants as scapegoats for an issue that you all refuse to seriously address? Because this bill does not seriously address anything to save American lives. This bill would dramatically widen the scope of Title 42, which is a public health measure intended for contagious diseases. But that is apparently not enough. Now, my colleagues on the other side of the aisle want to discriminate against immigrants with even greater impunity. Title 42 is already being stretched to its very limits. It has been a Trojan horse, and I want my Republican colleagues to know that everybody sees what's going on. We see you. We see how you are hiding behind a public health crisis to advance a xenophobic agenda. And not only will it spell life and death for some immigrants, it is also a distraction that will ultimately harm the American people who are suffering from addiction and need our real help, our real legislation. Title 42 has negatively impacted our asylum system, denying the right to a fair process for refugees who are often fleeing for their lives. This policy has been especially cruel to individuals in the LGBTQ community, children, and indigenous people from around the world. All of this in order to point the finger at immigrants for our American opioid crisis, even though my colleagues know that the majority of fentanyl brought into our country is done by Americans who bring it to our country. And to that end, Mr. Chairman, I request unanimous consent to submit a Cato Institute article entitled, quote, "Fentanyl is smuggled for U.S. citizens by U.S. citizens, not asylum seekers," end quote. I'd like to ask unanimous consent to submit it for the record.
Without objection, so ordered.
Thank you, Mr. Chairman. By turning Title 42 into a weapon, you are giving yourselves an excuse to turn away anyone you deem undesirable by the mere virtue of where they are fleeing from. Simply put, this is not what our great nation values. I urge my colleagues to unanimously reject this bill. The United States derives great strength from its immigrants. It's a positive part of who we are as a nation and always has been. Our country has always opened its arms to people who seek a better life, and I will continue to ensure that American lives right here in America are continued to have that promise, and those good people who choose to come here and contribute to our great nation continue to have that opportunity by the laws, both international and domestic, that we have afforded and said that we portend to be. And with that, Mr. Chair, I yield back.
The gentleman yields back. Anyone seeking recognition for further discussion? Seeing none, the question now occurs on forwarding H.R. 801 to the full committee. A roll call has been requested, so when the clerk calls the roll, if you favor, say aye. If you oppose, say no. The clerk shall call the roll.
Guthrie.
Aye.
Guthrie votes aye. Burgess. Burgess votes aye. Latta. Latta votes aye. Griffith. Bilirakis. Bilirakis votes aye. Johnson. Bouchon. Bouchon votes aye. Hudson. Carter. Carter votes aye. Dunn. Pence. Pence votes aye. Crenshaw. Crenshaw votes aye. Joyce. Joyce votes aye. Harshbarger. Harshbarger votes aye. Miller Meeks. Miller Meeks votes aye. Obernolte. Obernolte votes aye. Rogers. Eshoo. Eshoo votes aye.
Madam Chair, minute. Eshoo, you're recognized.
Eshoo votes aye. I have Eshoo's recorded. Ms. Eshoo is recorded as aye. Ms. Eshoo is off aye on no. Sarbanes. Sarbanes votes no. Cardenas. Cardenas votes no. Ruiz. Ruiz votes no. Dingell. Dingell votes no. Custer. Custer votes no. Kelly. Kelly votes no. Barragan. Barragan votes no. Blunt Rochester. Craig. Craig votes no. Schreier. Trahan. Pallone. No. Pallone votes no.
Who's not recorded? Ms. Rogers?
Ms. Rogers is not recorded. Rogers votes aye.
Mr. Griffith?
Johnson recorded.
Griffith is not recorded.
Griffith votes aye.
Griffith votes aye.
Mr. Johnson?
Johnson is not recorded. Johnson votes aye.
Mr. Hudson?
Hudson is not recorded. Hudson votes aye.
Anyone on this side? Ms. Blunt Rochester?
Blunt Rochester is not recorded.
Ms.
Blunt Rochester votes no.
Ms. Trahan?
Trahan is not recorded. Trahan votes no.
Is Mr. Dunn recorded?
Mr. Dunn is not recorded. Dunn votes aye.
Anyone else seeking to record a vote? Seeing none, the clerk will report.
Chair Guthrie, on that vote, there were 17 ayes and 12 nays.
With 17 ayes and 12 nays, the ayes have it. The bill is agreed to. The chair calls up H.R. 467 and asks the clerk to report.
H.R. 467, a bill to amend the Controlled Substances Act with respect to the scheduling of fentanyl-related substances and for other purposes.
Without objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point. So ordered. Does anyone seek recognition on the bill? For what purpose does the gentleman from Ohio seek recognition?
Mr. Chairman, strike the last word.
The gentleman is recognized for 5 minutes.
Thank you, Mr. Chairman. 10 cents is all it costs for drug cartels to manufacture one fentanyl-laced fake prescription pill that will kill one American. How much longer will we kick this can down the road until we can permanently schedule fentanyl and fentanyl-related substances as Schedule 1? This isn't about criminal justice reform. It's about justice for victims. We are simply holding criminals accountable and giving justice to their victims. The argument of mandatory minimums is null and void when you're killing Americans no matter how large or small the quantity of drugs. Let me be clear. If you are intentionally lacing fentanyl into illicit narcotics, you are committing murder and should be held accountable. Listen to these stunning statistics. There's a lethal fentanyl poisoning almost every 9 minutes in the United States, killing on average 175 people a day. This results in almost twice as many deaths in the 18 to 45 age range as COVID-19, cancer, car accidents, and suicide. 64,000 lives were stolen by fentanyl between April 2020 and April 2021. While we still don't have the final statistics for the following year, we're expecting them to be just as high, if not higher. This fentanyl crisis has simply spiraled out of control. It's poisoning our communities, claiming lives, and forcing families to grieve the loss of their loved ones. It is long past time that Congress acts and gives a voice to the voiceless. How many more lives will be lost before Congress finally addresses this weapon of mass destruction? For these reasons, I, along with my good friend, the gentleman from Virginia's 9th Congressional District, introduced H.R. 467, the Halt Fentanyl Act. This bill would permanently place fentanyl and fentanyl-related substances as Schedule I narcotic, while enabling researchers to continue studying Schedule I substances for the purpose of identifying potential medical benefits. This should not be a political issue. It's about addressing the largest poisoning of Americans in history of our country and taking steps to end the scourge. I encourage my colleagues to support the bill. And Mr. Chairman, I thank you, and I yield back the balance of my time. I yield to the...
Thank you. I strongly support H.R. 467, the Halt Fentanyl Act. This legislation, led by Representative Griffith and Latta, has been introduced in the past 2 Congresses and will permanently place fentanyl-related substances into Schedule I of the Controlled Substance Act. There are misleading claims that permanently extending the temporary scheduling of fentanyl-related substances is a, quote, failed experiment, unquote, on the basis that overdose and incarceration rates have increased since Congress originally passed the temporary scheduling order. This argument not only fails to recognize the very real pain and suffering thousands of families across the country have felt from losing a loved one to fentanyl poisoning, but it also completely misses the mark on why we permanently schedule fentanyl-related substances is needed. The point is, you can't die from ingesting something that never created, nor can you be incarcerated for selling something that doesn't exist. This is a direct quote from Dr. Westlake's testimony from a legislative hearing on the bill. In fact, in 2021 report from the Government Accountability Office provides evidence to support this argument. GAO's report that notes that between 2018 and 2019, when the Trump administration's 2-year emergency schedule order was in effect, DA records indicate that encounters with fentanyl-related substance dropped to 787, down from 7,058 during 2016-2017 before the order was in effect. The report even states that DEA and other law enforcement officials and the class-wide scheduling of fentanyl-related substances, quote, reduces incentives for criminal organizations to manufacture and traffic these substances to circumvent law enforcement and that such scheduling has helped reduce the number of reports of law enforcement encounters with fentanyl-related substances, unquote. Additionally, DEA told just last month, that permanently scheduling fentanyl-related substances is the #1 legislative priority. President Biden even acknowledged the severity of illicit fentanyl crisis. In the State of the Union speech, the president cites record numbers of illicit fentanyl seizures at the southwest border and said, quote, "Let's launch a major surge to stop fentanyl production and the sale and the trafficking," and calls for strong penalties to crack down on fentanyl trafficking, unquote. H.R. 467 is one of the many important solutions that would achieve both of these goals. I thank Representatives Griffith and Latter for their leadership on this issue. I strongly urge my friends across the House and the Biden administration to support this legislation that would keep this poison off our streets and help save precious lives. I yield back to the gentleman from Ohio. The gentleman yields back the balance of his time. Any member speaking? The gentleman from New Jersey, what purpose do you seek recognition?
Strike the last word and speak in opposition to the Halt Fentanyl Act.
The gentleman from New Jersey is recognized.
Thank you. Mr. Chairman, in a moment I plan to introduce an amendment that will substitute the text of the Halt Fentanyl Act with the SAFE Act, a bipartisan bill that reflects the Biden administration's comprehensive approach to address fentanyl-related substances. If Republicans are serious about legislating in this space, they should understand that any viable proposal must have bipartisan support. Last Congress, this subcommittee held a hearing to discuss the administration's interagency proposal, which is an agreement between DOJ, HHS, DEA, NIH, FDA, and ONDCP. And the administration's proposal does the following. First, it recommends a permanent extension of the existing class-wide scheduling order for FRS. Second, it expedites research for all Schedule I substances. Third, it creates an off-ramp to ensure that substances that are not harmful or have potential medical applications are not improperly classified. And fourth, it reforms mandatory minimum standards involving FRS unless an offense results in serious bodily injury or death. And then fifth, it enables individuals convicted of an offense involving an FRS that is subsequently removed or rescheduled to seek reduced or vacated sentences. Now, I think we should all agree that no one should be in jail for a substance that poses no threat to public health and safety. Shortly after the December 2021 hearing, our Republican colleagues introduced the Halt Fentanyl Act, which permanently schedules FRS. It also takes the administration's recommendations and updates to research registration procedures for research with all Schedule I substances. But then, since then, Republicans have refused to work with us on any of the remaining provisions recommended by the Biden administration. And it's important to note that Congress has voted to extend the temporary class-wide schedule of FRS multiple times. We did so again in the fiscal year 23 omnibus, which most of my Republican colleagues voted against, and the temporary scheduling order now expires in December of 2024. So I believe strongly that it's important to keep fentanyl and FRS strictly regulated while these substances continue to pose a threat to public health and are involved in a significant number of overdose deaths. However, permanent scheduling based on chemical structure alone is unprecedented. Similar class-wide scheduling structures for cannabinoids and anabolic steroids require an analysis of chemical structure and pharmacological effect. That means we look at the drug's effects on the human body, not just its chemical structure. And the administration took the unprecedented step of recommending permanent class-wide scheduling because of the magnitude of the current wave of the opioid crisis. But the federal agencies landed on a compromise that included the off-ramp because they understood that chemical structure alone does not determine the pharmacological effect of a substance. I strongly believe that these guardrails are necessary to ensure that preemptively scheduling a class of substances does not impede scientific discovery. The reforms to mandatory minimums are also critically important to ensure that we're not exacerbating existing inequities in the criminal justice system, an issue that me and many of my colleagues on the Democratic side feel very strongly about. And I am again disappointed that Republicans continue to choose partnership, or I should say partisanship, over compromise. These are not major differences of policy, in my opinion. And I believe if Republicans were willing to work with us rather than make fentanyl a political issue, we could solve this problem. We've come together in this committee to address many important and pressing issues last Congress, and so I urge my Republican colleagues to try to do the same here. The fentanyl and synthetic opioid crisis affects all of our communities. We have to work together and promote policies that take evidence-based public health approaches. And with that, I thank you, Mr. Chairman. I yield back.
The gentleman yields back. Anyone seeking recognition? The gentleman for Virginia, what purpose do you seek recognition?
Speak to the bill.
The gentleman is recognized for 5 minutes.
Thank you, Mr. Chairman. I appreciate it very much. Let me say first thank you to my co-captain on this bill, Mr. Latta of Ohio. He's done great work. You heard his comments earlier. And this is a very important bill, and there are actually major differences in our philosophy. And part of it is, I think, a misunderstanding of what the bill is trying to do. So let me address some of the misunderstandings, if I might. One, we hear from outside groups, and I appreciate I haven't heard it here today, but we hear from outside groups that this bill does not allow for research. Well, read the bill. It does allow for research. It's got a whole research component. There are ways to do the research. The dilemma we have when we had the testimony was there are tens of thousands of potential analogs. We've studied roughly 30 to 40 of those analogs already. Many of them, in fact, I would submit most of them, are dangerous opioid derivatives or opioid-like substances that mimic fentanyl. But this doesn't stop you from doing the research. And that was something that we felt very strongly needed to continue to happen, because there might be one of those tens of thousands of analogs that might have some benefit. I think it's unlikely, but it is theoretically possible. So we wanted to make sure we had that research and we didn't impede or restrict our research institutions. So then let's get to the major difference, and that is the mandatory minimums. Now, I understand my colleagues being against mandatory minimums. There are legitimate and serious concerns that our society needs to address with mandatory minimums. The problem is trying to deal with it as an offshoot or as a part of this bill is not the proper place to deal with that issue. Let me explain why. Because indirectly, and I would never accuse any of my colleagues on the other side of trying to reward clever drug dealers, but unfortunately that's what this amendment does. Because if you're facing a mandatory minimum for fentanyl and you can change the chemical construct just a slight little bit into one of those tens of thousands of potential analogs, which we cannot keep track of, and they have the resources because it's how they make their profit to do whatever they need to do to get around the law, all of a sudden, even if it's illegal, it doesn't have a mandatory minimum as the fentanyl would have. So you are indirectly, inadvertently, and I believe without intent to do so, rewarding clever drug dealers, clever cartel chemists, clever people working on the base ingredients in other parts of the world. And so for that reason, I have to oppose the amendment and be in support of the bill. I think this bill is long overdue. It covers all the real concerns, like research, which I want there to be research, because I think for too many years we've had situations with cannabis where we didn't allow the research, and now we've got all kinds of states making it legal. The federal government's not taking action to defend the federal law, and it's just the legal scheme there is just a mess. And a big part of it is we really don't know what we're doing because we haven't done the research for 50, 70 years. So I want the research to continue, because maybe there's something out there that we don't know today that research will tell us. So I think that's extremely important. But I do think that this is something that needs to be done. We need to send a clear message. And what's interesting is, even though we've continued the temporary and we have to keep going through this debate, it ought to be permanent because the research component is there. But because of that, we've also heard testimony that the attempts to get around the law have dramatically dropped, and that they're not cooking up a different, slightly different chemical formula to get around the law. I submit, if we adopt an amendment that says we're going to take away the mandatory minimums just on the analogs, just on the fentanyl-related substances, you will see that clever drug dealer once again trying to get around the law, and they will successfully do so, and they will go into court and argue for a minor sentence instead of a mandatory sentence, which they currently face, and we will have rewarded the bad actors for even worse acts than what they're doing today, by giving them a loophole to run through. And as a former criminal defense attorney, I can tell you there's lots of clever lawyers who will figure out that that's the problem, and they'll advise their clients accordingly. I yield back.
The gentleman yields back. Anyone else seeking discuss recognition? Anyone seeking recognition? Mr. Crenshaw, the gentleman from Texas, what purpose do you seek recognition? Sorry.
Thank you, Mr. Chairman. I move to strike the last word.
The gentleman is recognized for 5 minutes.
All right, I want to get right to the point. The illicit fentanyl epidemic is not receiving the attention it needs. That's what this bill is about. In my own home county, fentanyl kills at least one person every day. And I'm pretty taken aback by, I think, the casual tone some of my colleagues have taken about this crisis. Just earlier, it was stated that if it weren't for demand, well, then weren't for demand for drugs, then this wouldn't be a problem. So, I mean, what does that make this? The victim's fault? You know, God forbid we actually take the fight to the dealers and the cartels who lace street drugs with deadly fentanyl and kill teenagers who thought they were taking a Xanax or an Adderall. Is it the dead teenagers' fault? Not the dealers? Not the cartels? Is there really no consideration of the fact that the supply creates the demand here? Because it does. One of my colleagues just stated that it's not the cartels killing Americans, it's Americans trafficking fentanyl and killing Americans. That statement was not only false and deceptive, but kind of horrific. And I hope the families of tens of thousands of young people poisoned by fentanyl are listening to this hearing so they could hear all that. I've heard that this bill could inadvertently punish someone who has quote-unquote harmless analogs of fentanyl. I mean, what kind of person are we talking about? What scenario are we imagining there? It's an absurd idea. This bill is simple and it should easily be bipartisan. It's about deterrence. Criminal penalties can have a meaningful impact on criminal behavior. As a 2021 report from GAO reviewed law enforcement officials and found that class-wide scheduling had reduced the incentives to make new and existing fentanyl substances. Schedule I classification simply allows prosecutors to pursue the appropriate penalty for the crime and sends a clear message to drug traffickers and cartels that we mean business. The U.S. Sentencing Commission data for fiscal year 2021 released last year shows that the average sentence for fentanyl trafficking was just over 4 years. 4 years. So that's less than some people get for robbery. Does that seem right, given that 70,000 people plus are murdered every year because of this? Given the purposeful poisoning in our communities? Given the scourge that is inflicting on our country? Is 4 years really enough to punish those facilitating this crisis? Law enforcement needs the legal tools to prosecute the manufacturing, distribution, and sale of fentanyl, and any uncertainty about the penalties for these crimes will only embolden them. The cartels and their Chinese suppliers are purposely facilitating this crisis to destabilize our country and harm our citizens. Inaction on the part of Congress would be a glaring dereliction of duty, and I ask all members of this committee to support this common sense policy in a bipartisan way, and with that I yield.
Would the gentleman yield? Gentleman yield before he yields?
I'll yield.
Back?
Yes, sir.
I want to assure you that, you know, our side of the aisle is taking this very seriously, and I believe the president is doing so as well. As Mr. Griffith said, the president's proposal does have permanent extension of the existing class-wide scheduling order, and that's, as you know, we've kicked this down the road, and we're basically saying, no, we're not kicking it down the road again, we're going to make this permanent. And the research is also in the bill, in the president's proposal. I think that all we're really saying is that, you know, I don't know if you agree with me, but I just feel that mandatory sentencing has created a lot of problems over the years. And, you know, I don't even really, I think that mandatory sentencing is generally not a good idea because the judge can hear the case and decide on the penalty, or the jury, depending on the circumstances. And all we're really saying with that aspect of is that it shouldn't be mandatory unless there is serious bodily injury or death. It doesn't mean that the judge can't impose a very serious offense. It's just that the administration's policy provides some safeguards, you know, like saying the off-ramp to ensure that substances that are not harmful or have potential medical applications are not improperly classified, and there are other things of that nature. I mean, I really think that if we wanted to get this done, you know, dare I mention the Senate, but if we want to get this done, you know, coming a little further along with the administration's policy, and this bill also has adopted some of that, is more likely to result in something that passes the Senate and that the president signs, rather than keep meeting this deadline where we have to kick the can down the road. I
And
think we take
I
it-
understand. May I reclaim my time? Because I
Yeah,
don't
of
have
course,
much time to respond. And I appreciate your thoughts, and I appreciate where your heart is at. And of course, we disagree on the matter. I think Mr. Griffith made a very compelling case as to how trying to anticipate thousands of different analogs will be an ineffective strategy. We're not dealing with a normal drug here. We're dealing with the poisoning of 70,000+ Americans. It's murder at this point. That's where we're coming from. I think most Americans agree with that. And I think not passing this out of the House and getting the president to sign it, I think, would be a dereliction of duty on the part of our government. And with that, I yield back.
The gentleman yields back. Anyone seeking recognition? Discussion? Anyone on? We had Mr. Bill Ruckus. What purpose, gentleman from Florida, seek recognition?
Speak to the bill. I'd like to.
Gentleman's recognized for 5 minutes.
Thank you. The headlines in the news in January and February around fentanyl are disheartening and include many headlines of toddlers, adolescents, and young adults that have died already in 2023 of fentanyl poisoning. I'm saddened that the overdose epidemic continues to get worse across our nation, and as we move forward, we must embrace a collaborative approach. We must work together to continue to address this epidemic, and we must do more to reduce the supply of fentanyl substances in our country. The Halt Fentanyl Act will do just that. We held roundtables, Mr. Chairman, hearings about how bad this problem is, and we're overdue. We must address this, and it must be a permanent scheduling of illicit fentanyl-related substances. It's time for action. This is a far-reaching problem with deadly consequences. All states are now border states as we work to address the amounts of fentanyl compounds that are flooding in from China and India into Mexico and then across the southern border. This drug has created a public health crisis of massive proportions. Currently, fentanyl overdose is the leading cause of death in the nation for individuals ages 18 to 45. The Biden administration's lax approach is neither productive nor effective. My home state of Florida is suffering as a result, surpassing the alarmingly high fentanyl overdose rates. Now I have been very proud to be part of this particular subcommittee, and we've worked in a bipartisan fashion. We've completed great work to address both mental health and substance use disorder. We must, and I say again, we must again come together to address the influx of fentanyl within the illicit drug market. I know Republicans on this committee are prepared to take action by passing the Halt All Lethal Trafficking of Fentanyl Act as soon as possible, and I hope our Democratic colleagues will take this solution seriously and join us in this effort. Time is of the essence, folks. We've got to do it. People are dying. Our kids are dying. We can't take it any longer. I know people in my community where the children have passed away, and again, they're deciding to go out for an evening, and they think they're taking a recreational drug. They shouldn't be doing that, but they don't deserve to die, and that's exactly what's happening because it's being laced with fentanyl. And it's very unfortunate, and we must act now. I want to thank, again, Mr. Latta and Mr. Griffith for their efforts to move this forward. There's no time to waste. The time is now to act to protect American people from the threat that fentanyl poses. We must stop the creation and spread of new fentanyl-related substances. Please, ladies and gentlemen, let's work in a bipartisan fashion, but let's get this done. We can't dilly-dally around anymore. The research is in this particular bill. Let's vote down the amendment and pass this bill as soon as possible. Get it to the full committee and to the Senate on the president's desk. Time is of the essence. People are dying. Our children are being poisoned. That should be enough. Thank you very much, and I yield back the balance of my time.
The gentleman yields back. Anyone seeking recognition? Gentlelady from California, for what purpose you seek recognition?
Just strike the last word, Mr. Chairman.
Gentlelady is recognized for 5 minutes.
I thank the chairman. What I'm so struck by are two things. that I want to point out. Number one, we are unanimous in decrying what is taking place in our country, the number of deaths and the destruction that that has brought across every single congressional district in the country. We all agree, and everyone is saying the same thing, repeating it over and over and over again. So we're unanimous in understanding the horrors of the poison that pills are laced with. What I'm really struck by is that this legislation makes permanent the status quo. It makes permanent the status quo. I don't know if it's dawned on anyone, but it makes permanent the status quo. So where's the solution? In our hearing, there were, 9% of those that are stricken, that need help with their addiction, only 9%, and we had testimony from the witnesses, where only 9% of Americans can get any help on this. This bill doesn't change that. So, where there is a disagreement, and it's been acknowledged, is on the mandatory minimum sentences. But I don't think anyone can walk out of here today and claim that they've done something with the cartels against them, against these murderers. You're right when you call them murderers. We all agree about that. We're decrying it, but there isn't anything in this bill that addresses the very things that we are talking about. So if it makes you feel better to codify the status quo, say that. Say we're making it permanent, because that's what this bill does. There isn't anything in this that does anything with the cartels against them that puts a stop to the horrors that we have all decried with great legitimacy. With that, I yield back the balance of my time.
Would you yield?
I'd be glad to.
I just, the status quo, if we remember, we had the testimony from the physician from Wisconsin that said, we have a horrible problem with fentanyl that's coming into our country, but there haven't been creations of new fentanyl analogs since this has been put into place. So we haven't, absolutely, we are all going to work together. We talked about, I know we're going to work together on the Support Act. We've already talked about it.
Well,
But I just wanna
reclaiming my time, this bill makes permanent the status quo. I yield back the balance of my time.
The gentlelady yields back. Then Mr. Dunn. Mr. Dunn, you seek recognition?
Thank you, Mr. Chair. I move to strike the last word.
Gentleman's recognized.
I would like to associate myself with the remarks of my colleagues regarding the seriousness and the immediate danger posed by fentanyl-related substances. I'm pleased to see this important piece of legislation considered before our committee, and I hope it advances favorably and quickly. Each and every one of us has links to fentanyl crisis. Every one of our districts has been touched. We must enact policy that will help get this poison, and I emphasize that term, poison, not drugs, poison off our street. Keep it away from our children. My sheriffs, in all of them, 19, they're all begging us to schedule this drug as Schedule 1. This bill is common sense. It's already the law of the land in most of the world. It's the right thing to do, and I hope to see all of my colleagues supporting it today. With that, I yield back.
Would you yield? Would the gentleman yield?
Yes, I will.
Thank you. I thank the gentleman for yielding. Let me say there's a reason that the DEA has this as one of their top priorities, and that's because this policy will work. We have seen a shift since we went with the temporary program. We've seen a shift from the drug cartels and their allies trying to come up with new chemical formulas that would get around the law to to just doing the fentanyl, which doesn't sound like that's a good thing, but it's a very good thing that we've shut it down. We've narrowed the scope that our folks in law enforcement have to be ready to face. Instead of facing hundreds or thousands of potential analogs that they have to test at the various laboratories or even in the street, they now have one substance that they can focus on. That's a help. That's why the DEA wants this bill to pass. Further, let me state this very clearly. If all you're looking at is the scheduling of the analogs, or once amended, fentanyl-related substances, then you might say, well, that's status quo. You could make that argument, although it's not permanent. It's not permanent currently, so we're changing the status quo to make it permanent. But further, the whole research component, the detailed information on what you can do to research what's impacted, what's not impacted, et cetera, is all brand new in this bill. That is not status quo, and it's something I think our researchers want across the board so they can continue to study this powerful set of substances to see if there's something positive. I think it's going to be hard for them to do that, but, you know, this is why you study these things, and I like to see research being done, and this bill creates and breaks the status quo on getting the research done. It may be why some of the outside groups have said that this doesn't have the research, because right now they're not being able to do the research, and if they're being told this bill's status quo, no wonder they think that, because it's not status quo. So I would hope that folks would realize when they go to vote on this, it does a lot of good things, and it breaks the current status quo on research, and it makes permanent the current status quo, which has stopped the bad guys from trying to find ways to get around the law. They realize they're just going to have to deal with the law the way it is.
Would the gentleman yield?
I actually have to yield back to Mr. Dunn. He has control of the time.
And I will further yield the time, yes.
Oh, to me?
You're going to yield to Mr. Palone?
Oh, I'm sorry.
Yes.
I just wanted to say, look, I don't think I disagree with you on the research. I mean, as we said, the administration's policy says we want to do the research and we want to make permanent the class-wide scheduling. I think the problem, though, and this is where I agree with everything Ms. Eshu said, is that, look, even with the changes you said, the overdose crisis is getting worse, more and more problems, more and more people dying. So she's right when she says that, you know, unless you do more, which I put words in her mouth, but unless you do maybe more for enforcement or you do more for treatment or you do more for education, it's not likely that just having a permanent extension or doing the research is going to decrease the crisis. But all I'm saying is that why don't we just go along, and we sort of already did my amendment, although I guess it may come up next. Why don't we just go along with what the administration is doing? Because I don't think you really disagree with us that much, and at least that gives us a better chance of having this bill move so we don't just kick the can down the road. But thank you, and I yield back to the gentleman.
I yield back my time, Mr. Chairman.
Gentleman yields back. Anyone seeking recognition? For what purpose the gentleman from Florida seek recognition? Gentleman from gentleman from Pennsylvania.
Mr. Chairman, I move to strike the last word in support of the act.
Gentleman is recognized.
Thank you, Mr. Chairman. I'd like to thank both Chairman Griffith and Chairman Latta for all their work in getting this crucial bill before us today for consideration by the subcommittee. Stopping the scourge of illicit fentanyl substances and the tragic impact that they have on our nation, and specifically on my community in Pennsylvania's 13th Congressional District, is incredibly important. We've heard it. We've heard it in this room. Earlier this year, we heard incredibly powerful testimony from two of my constituents, Ray and Deb Collin, who tragically lost their son to fentanyl poisoning. Their loss, and those that have felt this across our nation, underscores how critical it is that we act today to permanently schedule fentanyl-related substances class-wide. In 2022 alone, the DEA seized almost 379 million deadly doses of fentanyl, which is more than enough to kill every single man, woman, and child in the United States. And that's just what was seized. These drugs are flooding our streets, leaving destruction, pain, and ultimately, in many cases, death in their wake. The CDC estimates that illicit fentanyl or fentanyl-related substances are responsible for the most overdose deaths in this country. I firmly believe that we must empower law enforcement with every tool that is necessary to stop those who traffic these deadly substances into our communities. And this starts with permanently scheduling these substances and giving certainty to those investigating and prosecuting transnational gangs and traffickers that are dispensing these deadly drugs into our community and poisoning our friends, our neighbors, and children throughout America. I strongly urge the passage of this legislation, and I yield the balance of my time.
The gentleman yields back. Anyone seeking recognition? The chair, what purpose does the gentleman from North Carolina seek recognition?
Strike the last word.
The gentleman's recognized for 5 minutes.
Thank you, Chairman, and I'm proud of our committee for addressing this issue. It's affected millions of Americans. In North Carolina alone, fentanyl has claimed the lives of more than 4,200 people just last year. Many of these were young people who had no idea the substance they were using was laced with deadly fentanyl. This includes people like Matthew Thomas from Sanford, who lost his life after an accidental exposure in 2020. I was inspired when I met Matthew's mother, Wendy, who's turned her loss into advocacy to warn parents and students about the dangers of fentanyl. Her mission should be one that, her mission is that no parent should experience the pain that she's experienced. And I appreciate the words from my friend, Ms. Eshu, when she says we need to do more than just this legislation, and I couldn't agree more. And I think one thing we can do is help spread the word to educate parents, educate students about the dangers of this poison. Our open border policies are fueling this crisis, and I think that's another area where we need to do more. We must secure our border to stop the flow of this deadly poison. But today we have an opportunity to do something. That's to send a message to those who profit on the lost lives of young Americans. Send a message to them that we're not going to tolerate and we're not going to allow loopholes. This is one small step in curbing this crisis, but it's a good step. It's a necessary step, and I encourage my colleagues to support this legislation. With that, Mr. Chairman, I yield back.
The gentleman yields back. Anyone seeking time for a purpose of discussion of the bill? The gentleman, what purpose does the gentleman from California seek recognition?
Mr. Chairman, I move to strike the last word.
The gentleman is recognized for 5 minutes.
Mr. Chairman, I am very proud to be a co-sponsor of this bill. It solves a very serious problem in my district. I have been in elected office 18 years now, and my worst day in office was last fall when I had to console a constituent who lost both of her sons in the same day to fentanyl poisoning. And as a father of 2 boys, I can't imagine what that's like. It really, really rocked my world to have to share those emotions with that woman. This is an issue that impacts districts across the country. In my particular district, fentanyl-related deaths are up over 600% in the last 18 months. It's not inaccurate to describe it as an epidemic. This bill makes some common sense reforms that will meaningfully help our law enforcement agencies and our federal government and state governments to deal with this problem, in particular by making permanent the rescheduling of fentanyl as a Schedule I narcotic. I would hope that we can get to a bipartisan place on this bill, but it's really desperately needed to solve these problems in communities like mine, and I urge support. I yield back, Mr. Chairman.
The gentleman yields back. Anyone seeking recognition for the purpose of speaking on the bill? Anyone seeking recognition for the purpose of amendment? Let me grab the... So for what purpose does the gentleman from New Jersey seek recognition?
I have an amendment at the desk. Looks like SED-AMD_04.
The clerk will report, oh, I'm sorry. The clerk will report the amendment.
Amendment to HR 467 offered by Mr. Pallone. Strike section.
Without objection, the reading of the amendment is dispensed with, and the gentleman from New Jersey is recognized for 5 minutes in support of the amendment.
Thank you, Mr. Chairman. I think we kind of discussed this amendment already, but the amendment before us substitutes the text of the Halt Fentanyl Act with the SAFE Act, a bipartisan bill that reflects the Biden administration's comprehensive approach to address fentanyl-related substances. I think the administration's proposal represents a strong interagency compromise that takes the unprecedented step of recommending permanent class-wide scheduling of FRS and couples it with reforms for research with controlled substances and penalty requirements under the Controlled Substances Act. We all agree from the previous statements that we all made that it's important to provide law enforcement with the appropriate authorities and resources to hold bad actors accountable. I don't think there's any dispute on that point. However, we have been following a criminalization first playbook for many years and still find ourselves in another wave of the opiate crisis. This problem did not start with fentanyl. The problem started with the saturation of legal opioids by legitimate manufacturers, distributors, and practitioners across the country. We've taken steps to regulate and control these drugs in health settings, but we've not fully addressed the health needs of those who experience substance use disorders. The HALT Act in its current form maintains the status quo. I think Ms. Eshu made that quite clear. And I fear that it will not lead to Americans assessing care nor save lives. We have seen as much during the past 4 years of class-wide scheduling of FRS wherein overdose deaths have actually skyrocketed. And for these reasons, if my colleagues are serious about getting to work and getting something that can actually pass and be signed, I would urge my colleagues to consider the SAFE Act and the additional guardrails it provides in conjunction with permanent scheduling of FRS. These provisions have bipartisan support, were agreed to by the Department of Justice and DEA, the Office of National Drug Control, the Departments of Health and Human Services, including FDA and NIH. While there are important and meaningful differences between the Halt Fentanyl Act and the SAFE Act, they are not insurmountable. If my Republican colleagues can work together with us on a bipartisan basis, we can address this issue. And we must also continue to work to examine evidence-based bipartisan approaches to expanding access to treatment for substance use disorders and work together to ensure that families and communities across the country are aware of the dangers associated with fentanyl and fentanyl analogs. And if we're going to make meaningful reforms, we must set aside, our differences and roll up our sleeves and get to work. Again, I don't want to keep repeating what Ms. Eshu said, but she is absolutely right. I mean, more enforcement, better education, treatment, all these things are crucial. And if all we do is, permanently extend the scheduling and include the research, I don't think that we're going to really do much to change the status quo, and the problem's only going to get more severe. So, because I'd like to see a solution that actually gets signed into law and passes the Senate, if that's possible, I would ask support for this amendment, and I yield back.
The gentleman yields back. Is there discussion of the amendment? The gentleman from, what person is the gentleman from Virginia seek recognition?
To speak to the amendment.
The gentleman's recognized for 5 minutes.
Mr. Chairman, I appreciate you recognizing me to speak to the amendment. In talking about the base bill, talked about this amendment as well because I think it's important. There is a conflict in philosophy. What we're trying to do is to move the ball forward. It's true that this bill in and of itself will not stop the fentanyl crisis. I've never made that an argument. The argument is we need to make it harder on the bad guys in the cartels and their allies overseas who give them the base ingredients. We need to make it harder on them, not easier. The bill as it exists without the amendment makes it harder on the bad guys. The bill with the amendment makes it easier on the bad guys. I asked the committee to make it harder on the bad guys and vote no on the amendment. You want my time? I yield to the gentleman from Ohio.
Well, thank you very much, and I appreciate my colleague and good friend and on this piece of legislation. Mr. Chairman, by eliminating the mandatory minimums for the fentanyl-related substances, we're giving a win to the cartels. When you look what's been going on, and, just in this committee alone, we had a DEA official in here that said this bill is their top priority. Their top priority when he testified before us. And, I had mentioned a little bit earlier that the DEA also mentioned that when you think about that the cartel are making these pills for 10 cents and selling them for 30 and killing Americans for a dime, we have to think about that. We had a roundtable discussion where a sheriff said that, what we're looking at here, when we were talking about drug overdoses and drug poisoning, he said, no, it's murder. So when, if somebody's putting fentanyl in these tablets, it is murder. It's plain and simple. And that's what the sheriff said when he testified before the roundtable. So, I think it's important that we remember these things because, again, the mandatory minimum serves as that tool to deter, as my friend has said, to these criminals. And that's what we're talking about. These are criminals. These are people that are intentionally putting drugs in something they know will kill you. We've had the DEA charts that we've shown around my district that has that big penny and just showing those 2 small flakes of fentanyl. And someone, when they put that in there, they know that that amount will kill you. And so we have to, if we eliminate this deterrent, we're essentially giving a green light to the criminals to keep flooding our streets and our communities and incentivize them to keep producing that fentanyl-related substance without fear of the true consequences that they should face. And, our law enforcement faces it every day when they go into any types of buildings or get into different cars. They get in these things. And I know in my area it happened that an officer had been in a building. And the next thing that happened, they turned the air conditioner on and some of the fentanyl that was on their clothing got floating around in the car and they inhaled it. And fortunately, there was enough Narcan there to save that individual. And, I am not one that wants to say that we want to make sure that an individual that's doing these kinds of things should not get off without the strictest penalties. So, Mr. Chairman, I believe that we need to oppose this amendment. But, what we're hearing over and over and over again is we see the parents come before us in committee that, how often do we have to say we're sorry? And, they say, what are you going to do about it? And when we see these drugs flowing across our border and coming into this country, it's time for this committee to act. And, Mr. Chairman, I yield back the balance of my time.
I yield back.
The gentleman yields back. Anyone for this purpose of discussing the amendment? The gentlelady from California. What purpose do you seek recognition?
To speak in support of the amendment, Mr. Chairman.
The gentlelady is recognized.
Strike the last word. Mr. Chairman, thank you for recognizing me. I support Mr. Pallone's amendment because it does move the ball down the field. Neither the Republican bill that's being considered, the underlying legislation, or Mr. Pallone's amendment do everything that we're all wishing for. What I wish is for every time we tell a story about what's taken place in our district, which is beyond heartbreaking, that there would be thousands of stories in the Congress and therefore magically something would happen simply because we keep telling the same stories. Fentanyl substances have been scheduled for 5 years, colleagues. Scheduled for 5 years. Over those 5 years, unfortunately, overdoses have gone up over 50%. That's what, in making this permanent, I support making it permanent, but I don't think that there is magic to making it permanent. It's not going to flip our stories, our heartbreaking, tragic stories of what's taking place in our country. So it's misleading to say to the American people that by adopting the legislation, that this is going to go away. I wish the account of the multiplicity of stories was the magic potion. But it's not. It's not. At least this amendment has steps that it takes to help to get us to where we need to be. But your underlying bill, I don't know how you can say with a straight face to the American people that you're really addressing what these tragedies are. Also, Medicaid is the single largest payer of substance use treatment, but the front page of the New York Times today reports that House Republicans plan to drastically cut Medicaid. That guarantees another layer of disasters for people in our country. So, as my blood pressure has gone up over this, that we are putting in place the status quo and promising the American people that we're addressing what's taking place. It's not the case. It simply is not the case, and I yield back.
The gentlelady yields back, and the chair recognizes himself for 5 minutes to discuss the amendment. So we're talking on status quo. So the amendment will reverse the status quo. The status quo is temporarily fentanyl analogs are permanently scheduled. And when this went into place, we had testimony from the physician from Wisconsin, Dr. Westlake, that the proliferation of fentanyl analogs ceased. We have illicit fentanyl. It's coming across the border. Look what's happened in border crossings in the last 2.5 years. We need to focus on that as well. But when you're reversing the status quo, when you're unscheduling or taking away the mandatory minimums, which gives incentives, it gives the different direction to create these fentanyl analogs. And we had a member of the administration says, well, what if they create a fentanyl analog that's as harmless as water? I mean, what? That wasn't even a serious statement. I was actually embarrassed for the witness that said that, and I said that in the last hearing we had. And that's because what criminal is going to be in Mexico trying to make harmless fentanyl to send to America? And it was just grasping at not permanently scheduling, making it subject to the mandatory minimums. So why would we've all talked about fentanyl and the potential of fentanyl analogs to be developed. Why would we treat fentanyl less and fentanyl analogs less than other illegal drugs throughout this country? I just don't understand why the status quo is not sufficient to solve this problem. We know that, but I don't understand why we would go backwards. I just don't understand the argument for that whatsoever. And I think that's a defense of my objection to this amendment. I will yield back, and anyone else seeking discussion on the amendment? Seeing none, if there's no further discussion, the vote occurs on the amendment. All those in favor shall signify by saying aye. Aye. All opposed, nay. Nay. The nays have it, and the amendment is not agreed to. If there's a request for a roll call vote?
Oh, there is.
You request a roll call vote? Oh. Is there a request for? There is a request for a roll call vote, so there is a request for a roll call vote, so the clerk will call the roll.
Guthrie.
No.
Guthrie votes no. Burgess. Burgess votes no. Latta. Latta votes no. Griffith. Griffith votes no. Bilirakis. Bilirakis votes no. Johnson. Johnson votes no. Bouchon. Bouchon votes no. Hudson. Hudson votes no. Carter. Carter votes no. Dunn. Dunn votes no. Pence. Pence votes no. Crenshaw. Crenshaw votes no. Joyce. Joyce votes no. Harshbarger. Harshbarger votes no. Miller Meeks. Miller Meeks votes no. Obernolte. Obernolte votes no. Rogers. Rogers votes no. Eshoo. Eshoo votes aye. Sarbanes. Sarbanes votes aye. Cardenas. Ruiz. Ruiz votes aye. Dingell. Dingell votes aye. Custer. Custer votes aye. Kelly. Kelly votes aye. Barragan. Barragan votes aye. Blunt Rochester. Blunt Rochester votes aye. Craig. Craig votes aye. Schreier. Trahan. Trahan votes aye. Pallone. Pallone votes aye.
Anyone seeking recognition to record their vote? Anyone seeking recognition to record their vote? Seeing none, the clerk shall report.
Chair Guthrie, on that vote, there were 11 ayes and 17 nays.
With 11 ayes and 17 nays, the amendment is not agreed to. For what purpose does the gentleman from Virginia seek recognition?
Mr. Chairman, I have an amendment at the desk.
The clerk will report the amendment.
Amendment to H.R. 467, offered by Mr. Griffith of Virginia. At the end of the bill, add the following.
Without objection, the reading of the amendment is dispensed with, and the gentleman from Virginia is recognized for 5 minutes in support of the amendment.
Thank you, Mr. Chairman. I hope that this is a pretty simple amendment. What we've done is we've taken the language of the bill, we've gone in and based on a case out of New York, United States versus McCrae, we've made sure that we adopted the language. They upheld the underlying statute that this would make permanent, but they also, got into a long debate over some of the wording. And while they ruled with us, this would make the language clearer, to make it clear that we're talking about fentanyl-related substances and any analog as described in the amendment. I yield back.
Is there any discussion on the amendment? The gentleman from New Jersey is recognized for 5 minutes.
I move to strike the last word and speak in opposition.
Gentleman is recognized.
To the amendment related to mandatory minimum penalties. This amendment goes beyond what is currently law and is an explicit admission, in my opinion, of the fact that Republicans believe they can incarcerate their way out of a public health crisis. My Republican colleagues have taken great issue with reforms the Biden administration has recommended for mandatory minimums related to FRS. The administration proposal calls for mandatory minimums to not apply to the FRS preemptively classified in Schedule I unless an offense leads to serious bodily injury or death. And it's important to note that people charged with an FRS offense would still be subject to strong penalties outlined in U.S. sentencing guidelines. Moreover, my Republican colleagues have argued that any reforms to mandatory minimum penalties will result in an influx of new FRS, but there's no evidence to support this. Criminals and transnational cartels who seek to distribute illicit drugs have not been deterred by existing criminal penalties and show no signs of reducing supply to meet the demand in this country. No one is arguing to weaken law enforcement. People must be held accountable if they're breaking the law. However, I and many of my Democratic colleagues believe it's time to address fentanyl and FRS as the public health crisis that it is. And criminalization-first policies have exacerbated substance use, stigmatized individuals who experience substance use disorders, and discourage people from seeking treatment. So I'd like to turn the page and find bipartisan solutions, as I mentioned before, that proactively save lives and keep our families and communities healthy. I don't think this accomplishes that. And with that, Mr. Chairman, I yield back.
The gentleman yields back, and the chair will recognize himself for 5 minutes to discuss the amendment, and I will yield to the gentleman from Virginia.
Thank you very much, Mr. Chairman. I would just say that this is a pretty simple amendment. I understand the objections that the other side has raised on mandatory minimums, but I will tell you, when you say it hadn't made any difference, it hasn't made any difference on fentanyl deaths. But the cartels, et cetera, have not continued their attempts to bring in, since we put this as temporary, they have not continued to bring in the fentanyl-related substances as they did in the past. They were encouraged to do that because they thought they could get a better deal or even be found not guilty, as the McCrae case was exactly what they were arguing in that case. And the court found that this law that we want to make permanent made it illegal. And since that time, the testimony in front of the committee was they have stopped trying to figure out how to change the chemical compound in such a way, and that makes it easier on our law enforcement on the ground because they don't have to look at 10 or 15 or 30 different substances currently, or maybe hundreds of others in the future. They just have to focus on basic fentanyl. And again, let me say, this bill does not solve all problems. I have never said it was a magic elixir that was going to solve the fentanyl crisis in and of itself. But it does focus our law enforcement on fentanyl without them having to spend hours, countless hours, trying to figure out if the substance is an analog, and then when they go to court, trying to defend that this is one of the analogs that was meant to be covered. That's what happened in McRae. This simple amendment that I've proposed, and I thought it would be easier than this, the simple amendment just makes sure that we're complying with or incorporating McRae language, and it's just making sure that we're doing it right. And that's all we're trying to do with this amendment. I understand my colleagues on the other side oppose mandatory minimums. Mandatory minimums from fentanyl will continue. Mandatory minimums on all the other stuff will continue. That's a bill for another day, and that's a bill that they can discuss in the Judiciary Committee. This is a bill that needs to be passed today. They can deal with mandatory minimums on another day. And I yield back to the chairman.
I will yield back. So any further discussion on the amendment? If there's no further discussion, the vote occurs on the amendment. All those in favor shall signify by saying aye. Aye. All those opposed by nay? No. In the opinion of the chair, the ayes have it, and the amendment is agreed to. Is there anyone seeking recognition for an amendment? The gentleman from California is recognized for purpose of an amendment.
Thank you very much. I have an amendment to the Halt Fentanyl Act. I think it's amendment number 2.
Amendment to H.R. 467, offered by Mr. Cardenas. After Section 2, insert the following and redesignate the subsequent section accordingly. Section 3, publication of certain information relating to scheduling fentanyl-related substances. In general, no
Without objection, the reading of the amendment is dispensed with, and the gentleman is recognized for 5 minutes in support of his amendment.
Thank you, Mr. Chairman. Thank you for recognizing me. I'm just perplexed and heartbroken to watch the devastation that fentanyl is causing in our country. And it's not the first time that Americans have suffered from an addiction crisis, but this one I think is far, far greater than ever before. No family should have to lose a loved one like we've seen. And I know that fear myself, and I know that many of us have seen and witnessed it in our communities and sometimes in our own families. I've seen just how much substance disorder can grip a person and dominate their mind and their entire actions. Make no mistake, I feel the same sense of urgency as all of my colleagues in this committee and all of my colleagues in the Congress. It's my sincere belief that to do this successfully, Congress must address rising overdoses as the public health crisis that it is. We must treat addiction like the medical condition that it is. This means investing in harm reduction measures and meeting people struggling with substance use disorder where they are. And candidly, I'm concerned that this class-wide scheduling approach sets a precedent of guilt until proven innocent. I fear that we're doomed to repeat the mistakes of the past, doomed to perpetuate and exacerbate that war on drugs mentality. I fear we will be throwing more poor people and people of color in jails while watching the overdose deaths continue to climb. That's why I'm against the notion of permanently scheduling all fentanyl-related substances. But I also want to be clear. The proposal put forth by Ranking Member Pallone as elements that are far superior to that of the Halt Fentanyl Act. For example, Halt Fentanyl Act would impose harsh federal penalties, but does nothing to vacate or reduce the sentence if the substance in question is later removed from Schedule 1. Additionally, the Halt Fentanyl Act also does not do nearly enough to lower barriers to test for the potential harmlessness or even therapeutic value of these fentanyl-related substances. The next antidote to overdose could be a fentanyl-related substance that we haven't had a chance to test yet because of blanket class-wide scheduling. In other words, we're criminalizing compounds which haven't even been discovered yet. which brings me to my amendment. My amendment very simply requires the DEA to publish their scientific and medical evaluations of fentanyl-related substances on a public website. This is a transparency measure that should be uncontroversial. If we're serious about addressing this crisis, we should all have access to the most up-to-date information and scientific analysis of these substances. I ask my colleagues to support this measure, which would simply allow us to fight this crisis with clearer eyes and as much information as possible at the right moment. I urge yes on my amendment, and I yield back, Mr. Chair.
The gentleman yields back. Is there discussion of the amendment? The gentleman from Georgia is recognized for 5 minutes to discuss the amendment.
Thank you, Mr. Chairman. Mr. Chairman, I rise in opposition to this amendment because it is not necessary. This is already being done. The gentleman here is proposing a solution where there's no problem at all because this is already being addressed. When the DEA issues a proposed rule to schedule a substance, the analysis from HHS and DEA is included already in the background materials available to the public in the Federal Register. I'm not sure the problem that this amendment aims to solve because it's not a problem. It's already being done. It also seems counter to the goal of the legislation to schedule FRS as a class and avoid doing one-off rulemaking each time a new fentanyl analog is discovered. Mr. Chairman, let me assure you, I served 10 years in the Georgia State Legislature. And as a pharmacist on the Health and Human Services Committee in the legislature, we tried to do this with a lot of the analogs. And we were constantly, every year, having to update it because all they would do is just change it, just ever so minutely. This, the way we're trying to do it to Schedule 1, will avoid that problem. That's why we want to do it this way. Otherwise, we are going to be coming back every year just like a cat chasing his tail, and we're never going to catch it. That's why I'm just baffled as to exactly what we're trying to resolve here, because it's already being resolved here. If you look in the language in subparagraph 1, says, in any case where the Secretary of HHS has completed a scientific and medical evaluation of a fentanyl-related substance and has returned a scheduling recommendation to the DEA to place or not to place the fentanyl-related substance on a schedule pursuant to Section 201B of the Controlled Substance Act. Right there. So it seems to me that this should say to maintain on the schedule or remove from Schedule 1 if all fentanyl-related substances are going to be on Schedule 1 upon passage of this bill. This amendment is unnecessary. It is a solution looking for a problem because there's not a problem here. Mr. Chairman, for these reasons, I oppose this amendment today, but I'm happy to work with the gentleman to try to address his concerns he may have on current transparency in the scheduling process, but I want to assure you there's not any problems in the scheduling process right now. Thank you, Mr. Chairman, and I'll yield back.
Gentleman yields back. Is there further discussion? Seeing no further discussion, the vote on the amendment occurs. All those in favor for the amendment shall signify by saying aye. All those opposed, nay. Nay. The nays have it, and the amendment is not agreed to. Is there anyone seeking recognition for a purpose of an amendment? Seeing no further amendments? Well, we didn't ask it. Where's the final vote? The question. Hey, sir, you might want to do her. Oh, okay, she's come back. Jen Lacey, recognition? Yeah, you're good. Jen Lacey, recognition?
Put your microphone on.
Yeah. Clerk shall report the amendment.
Amendment to H.R. 467, offered by Ms. Blunt Rochester of Delaware.
Without objection, the reading of the amendment is dispensed with, and the gentlelady is recognized for 5 minutes Support of the amendment.
Thank you, Mr. Chairman. The amendment I'm offering will direct the GAO to analyze the implementation and impact of permanent class-wide scheduling of fentanyl-related substances, or RFRS, on research, civil rights, and the illicit manufacturing and trafficking of these deadly substances. This amendment will also require the GAO to analyze the role of social media in the proliferation of fentanyl and other synthetic opioids and investigate its role in ending the opioid crisis through public messaging and communication. I'm offering this amendment because the Halt Fentanyl Act lacks critical measures that will help us understand if the proposed policies work as intended. More specifically, not only does this bill take a one-sided approach to addressing the synthetic fentanyl crisis by not addressing the public health or criminal justice concerns that many experts have raised about the proposal, but it also lacks substantive accountability measures so we as lawmakers and experts can, at a minimum, assess if the specific policies in the bill reduce the supply and availability of new illicit FRS. The proposed class-wide scheduling of fentanyl-related substances is a first-of-its-kind policy. And in the midst of such uncertainty, we need continuous information to determine whether the country is moving in the right direction on the outcomes we seek to influence. Additionally, this amendment will help us understand how social media and electronic communication is used in the trafficking and distribution of counterfeit drugs laced with fentanyl and fentanyl-related substances. This information will help us develop evidence-based policies to protect our children and other vulnerable populations from these deadly substances. My amendment is a common-sense policy that will help us understand if we are actually moving the needle. I hope my colleagues on both sides of the aisle will vote yes. Thank you, Mr. Chairman, and I yield back.
The gentlelady yields back. Is there discussion on the amendment? The gentleman from Virginia is recognized for discussion on the amendment.
Discussing the amendment, I fear I must rise in opposition to the amendment. I agree that we need to conduct oversight to ensure that the Halt Fentanyl Act is achieving what I intend and what Mr. Latta intends and what we all intend the bill will do when it gets signed into law. But I fear that this amendment, unfortunately, is rushing the process. Now, we've received extensive feedback from the GAO, the Government Accountability Office, on the language that we believe would need to be incorporated into the language to ensure we are capturing adequate criteria and asking for the right information. So, as this moves forward to full committee, I look forward to working with the gentlelady in trying to get the language worked out. I don't know that we need to vote on it today, but that's your call. That would be her call, Mr. Chairman, but I'm happy to work with her on the language as we move forward to the full committee and trying to address this issue.
Will the gentleman yield?
Gentleman yields.
Thank you, sir, and look forward to working with you.
Thank you, ma'am.
Does any further discussion on the amendment? Seeing no further discussion, the vote occurs on the amendment. All those in favor shall signify by saying aye. All those, one aye. All those opposed will say nay. Nay. The nays have it, and the amendment is not agreed to. Is there any further recognition for the purposes of amendments? Seeing none, the question now occurs on forwarding H.R. 467 as amended to the full committee. All those in favor shall say aye. All those opposed, no. There has been a roll call vote requested. All those in favor will vote aye. All those opposed say, well, no. And the clerk will call the roll.
Guthrie.
Aye.
Guthrie votes aye. Burgess. Burgess votes aye. Latta. Latta votes aye. Griffith. Griffith votes aye. Bilirakis. Johnson. Johnson votes aye. Bouchon. Bouchon votes aye. Hudson. Hudson votes aye. Carter. Carter votes aye. Dunn. Pence. Crenshaw. Joyce. Joyce votes aye. Harshbarger. Harshbarger votes aye. Miller Meeks. Miller Meeks votes aye. Obernolte. Obernolte votes aye. Rogers. Rogers votes aye. Eshu. No. Eshu votes no. Sarbanes. Sarbanes votes no. Cardenas. No. Cardenas votes no. Ruiz. No. Ruiz votes no. Dingell. Dingell votes no. Custer. No. Custer votes no. Kelly. No. Kelly votes no. Barragan.
Excuse me.
Blunt Rochester. Craig.
Yes.
Craig votes aye. Schreier. Trahan. Trahan votes no. Pallone. Pallone votes no. Pence is not recorded. Pence votes aye.
How is Dunn recorded?
Dunn is not recorded. Dunn votes aye.
Anyone say it has Ms. Blunt Rochester recorded?
Blunt Rochester is not recorded. Blunt Rochester votes no.
Anyone else seeking? How's Mr. Bilirakis recorded?
Bilirakis is not recorded. Bilirakis votes aye.
Anyone else? Anybody else coming? Everybody we're good here? You guys good? Everybody got a chance to vote? Seeing no others requesting vote, the clerk will report.
Chair Guthrie, on that vote, we have 17 ayes and 10 nays.
With 17 ayes and 10 nays, the bill is agreed to. That's a conclusion, so. Without objection, staff is authorized to make technical and conforming changes to the legislation approved by the subcommittee today. So ordered. Without objection, the subcommittee stands adjourned. Thanks.